Good afternoon. Welcome everyone in this series of National Ayurveda Day. So, good afternoon. Welcome all of you in this national webinar, which is mainly planned on the occasion of National Ayurveda Day. I welcome all of you on this platform of Ayush Darpan. I welcome Dr. Roshni ma'am. Welcome ma'am. Namaskar. So, yeah, this is our third day or third अंगा अष्टांग आयुर्वेद के ऊपर हमने जो ये सीरीज प्लान की है, इसमें आज हमारा जो विषय है वो है ग्रह। तो काय बाल ग्रह ऊर्ध्वांग शल्य दृष्टा जरा वृषा, इसको लेकर हमने ये सीरीज प्लान की है। एंड देयर आर वेरियस टाइप्स ऑफ प्रोग्राम्स आर देयर स्पेशली फॉर ऑल द स्टूडेंट्स, यूजी पीजी स्टूडेंट्स, वैद्यास फ्रॉम ऑल ओवर द इंडिया। The international platform which is run by Dr. Naveen Joshi, this Ayush Darpan Foundation Trust, Dehradun, India, is working for the betterment of Ayurveda, for the propagation of Ayurveda, and with the organizing team, Dr. Arvind Pathak, Dr. Joshi sir, welcome you on this platform of Ayush Darpan. On behalf of the team, I welcome all of you. And now, Dr. Roshni ma'am is here. So first, we will go with Dhanvantari Vandana, and I request the moderator, today's moderator, Dr. Ketki Parlekar from Baroda, Gujarat, and she is also a singer. So I request Dr. Ketki for the Dhanvantari Vandana.
Thank you, ma'am. Let's start Dhanvantari Vandana. Shankham Chakram Jalokam Dadhatam Brutam Ghatam Charudaurбhiश्चतुर्भिः Sukshmam Swachhatirudyam Shukaparivilasanam Munimam Bhojanetram Kalambodhyojvalangam Katitatavilasascha Charupitaambaraಢ್ಯಂ Vande Dhanvantarim Tava Nikhila Gadamiva Praudhadavagnililam.
So धन्वंतरी वंदना के साथ हम लोग यहाँ पर उपस्थित सभी वैद्यों का स्वागत करते हैं। हमारे साथ है वैद्य रोशनी, अनिरुद्धन, और नेक्स्ट स्पीकर है डॉक्टर दिनेश सर। आज के सेशन के चेयरमैन है डॉक्टर राजीव कुरेले सर एंड डॉक्टर वंदना पाठक मैम। आई वेलकम मैम एंड सर ऑल द participants, all the Vaidyas, and I request Dr. Ketki, over to you, Ketki, as a moderator.
जी जी, yes ma'am. आजादी के अमृत महोत्सव के अंतर्गत नेशनल आयुर्वेदा डे की सीरीज में हम ये लेक्चर सीरीज चला रहे हैं और आज के हमारे पहले स्पीकर हैं मैम रोहिणी अनुराधन मैम. Ma'am completed her BMS from Government Ayurveda College, Thiruvananthapuram, and she completed her first PG in Samhita and Siddhanta and second PG in Kaumar Bhritya from Government Ayurveda College, Thiruvananthapuram, and she also completed PhD from Kerala University in Childhood Autism. So please everyone welcome ma'am. Ma'am, over to you.
Thank you. Today's topic is very interesting. I think child psychiatry and Ayurveda very rarely discussed a topic, and this subject also very rarely discussed. So I welcome you, ma'am, and please continue your session. And I welcome Dr. Vandana, ma'am, for the co-chairman, as Dr. Kurele sir yet not joined. So madam is with us, and she is working as an Ayurveda practitioner since long in Lucknow, Uttar Pradesh. Welcome, ma'am.
Can I share the screen?
Yes, yes, yes. Yes, ma'am. You can easily share as you are co-host.
Hope the screen is visible now.
Yeah, definitely. Yes.
So today's topic is about child psychiatry. So it's a vast topic. It's my field of interest. So I have to speak a lot on that. I hope I could concise it in a period of 45 minutes. And any discussions or any queries in between is most welcome. At the outset, I thank the organizers for selecting such an interesting area, and you have tried to cover all the Ashtangas of Ayurveda. And sorry to say that I'm not so fluent in. So I'll try to speak it in English, and I can easily understand.
Hindi, ma'am. If you can speak in between Hindi, it's better for us also. Because already
I'm not so fluent in that.
Okay, no issue. You can, as per your choice.
नहीं है हिंदी.
नहीं ठीक है, हम लोग सुनते हैं. हमारी कहाँ अच्छी इतनी चलता है. Yes.
So this is the platform of our college, where I am working. So we are having a specialty clinic for cognitive behavioral disorders, and usually the inflow of these autism spectrum disorders in that clinic it's around 500 to 600 cases per year. And attention deficit hyperactivity disorder, which comes the major part of this child psychiatry is around 300 to 400 cases per year, and it goes on like that. So that's why I was interested in this field, and this is our inflow, the snap of the patients coming to our specialty management centers as a camp conducted, inflow to our hospital framework. To speak it at an outset, I'm coming into child psychiatry. In the field of pediatric psychiatry, it can be divided into several sections, of which the development disorders, that is related with the development of the brain, comprises of the major spectrum, of which autism spectrum disorders form the major part of it. And then comes the learning disability. Then another sector which is concerned with attention and behavior, ADHD is the major forms, a major component. Then oppositional defiant disorder, that is negative behavior, is the conduct disorders, which is more common in adolescents. Then psychotic disorders are the childhood schizophrenia is a major component of that. Then mood disorders, mood fluctuations like depressive disorders, bipolar disorders. These depressive disorders are very common nowadays when the schools are all shut down and the online classes are going on. The mood disorders have become more common. And another sector is related to psychiatric disorders, but panic disorders, phobias like hydrophobia, claustrophobia, everything comes under that. Then OCDs, obsessive compulsive disorders, also forms under this, anxiety disorders. And next comes the eating disorders, that is anorexia nervosa, that is, and bulimia nervosa, that's overeating and less eating comes under this pediatric psychiatric disorders. Among this vast area, I'll be concentrating my talk mainly on two disorders today, like ADHD and childhood autism, because for an Ayurvedic practitioner, it's a main challenge which is coming to us, and we have much better options than any other field of medicine for a better cure and better prognosis we can offer. So I'll be discussing majorly attention deficit hyperactivity and autism spectrum. If any queries or doubts in between regarding any of these diseases under child psychiatry, I'm happy to discuss about it. A quick brush up regarding this attention deficit hyperactivity disorder, I call it as by the ADHD. Then the age of onset is usually preschool, and it comprises of almost 3 to 5% of kids are involved, are affected with this ADHD. And the male ratio is 3 times more than the female ratio. So boys are more affected with ADHD. Although genetic factors are involved in the involved in the etiology of ADHD, but neurotransmitter mechanism, the over release of neurotransmitters, reduced production of neurotransmitters, brain abnormalities, and especially regarding the prefrontal cortex. Abnormalities or reduced function of the prefrontal cortex, especially caudate nucleus and globus pallidus are the main pathology, main sites or Rogadhisthana forms like prefrontal cortex, caudate nucleus, and globus pallidus. If you do an fMRI study, functional MRI study, less perfusion and reduced metabolic rate is noted in this frontal lobe and this caudate nucleus. So our site of action, the drug site of action should be that caudate and frontal nucleus. Coming to the signs and symptoms of ADHD, extreme and persistent restlessness of the baby is noted. And baby is having a sustained and prolonged motor activity. He will be running away like as if driven by a motor, and he will be having a difficulty to maintain an attention towards a single task, especially in the studies. He won't be able to maintain his attention. He'll be easily distracted, and usually he will be having a high degree of impulsivity, that is difficulty or delaying withholding responses. Like if someone, if a teacher or a mother is giving him a with a stick, he is giving him a small clap, he will in return he will respond like anything. That's impulsivity. So this is the cardinal features regarding three classical findings are the attention deficit will be the, hyperactivity will be the, and impulsivity. These three are the cardinal features. Attention deficit hyperactivity, as the name itself implies, is attention deficit hyperactivity, and the third feature is impulsivity. He will be impulsively reacting to the stimulus which he is getting. So he'll be fidgeting with hands, feet, and he'll be running about like as if driven by a motor. He'll be running, he'll be climbing stairs. He won't be sitting quietly, which is expected to be in a class or a situation. He won't sit quietly. He will talk excessively, and he will burst up with answers when even if he is not expected to do so. He can't wait for his turn for a play or anything, and he will disturb others like anything in the class. And regarding inattention, he cannot pay close attention to the class, and he will be disturbing others nearby, the kids nearby. He won't listen to the teacher's commands. Even though he can comprehend the command, he don't listen to, or the obedience level is very less. And he can't organize a small activity. If a teacher is giving or a mother is giving a job like do a homework for such and such time, he won't be able to do so. He will be forgetting his pen in the class. He will be forgetting his rubber. He won't be able to organize this activity. He doesn't have the attention to do such an activity. So usually he loses all his personal belongings in the class or anywhere he goes, and is easily distracted and forgetful also. So the usual management pattern which we follow nowadays in the contemporary medicine is that educational management. So it's difficult for a child with ADHD to attend a normal class. So he will be placed somewhere near in the front line of the teacher, in the front bench, where the teacher can have an access to the baby. He can, or he or she can give direct commands and give a direct observation of his activities, because it's boys usually involved. So I'm narrating it as a he. Different educational management will be there, and cognitive behavior therapy is the mainstream line. That is teaching the baby how to behave in the society. Then psychotherapy, that is conditioning his impulsive behavior and these temper tantrums, along with pharmacotherapy or medications. So educational management comes like minimizing the distracting stimuli, especially in the class or any working hours. And one-to-one tutoring, that baby, one teacher is supposed to teach one student. That is one-to-one tutoring. It's usually difficult in the present scenario, but when he is in a common class, he is made to sit in the front bench so that he is under the direct supervision of the teacher. And structured and predictable routines are, or fixed or structured routines are made for each day. He is supposed to wake up in a fixed time. He's supposed to have such and such lunch. He's supposed to go to studies, or he's supposed to watch the TV in a fixed time schedule. Usually they are not used to change the routine frequently. So structured routines are supposed to be made for these babies. And the mother or the tutor is supposed to set very short-term goals for each activity. He is not supposed to say that you should finish all these maths problems or all these science works within a period of 2 hours. You are not supposed to say such a command to that child. You are supposed to say that I'll be sitting along with you. We will have the pencil, one extra with us, and a razor and sharpener, everything, a bottle of water to drink, everything. And we'll sit together and we'll be finishing the work within a period of 15 minutes. And if you finish this work as early as possible, you can go out for a play. So that activity should be ended by a reward for that. So set short-term goals for less than 15-minute duration. And if you have a long assignment, break it into short assignments and set a goal for each one. And always you should have a physical contact with the child. It's better to pat or keep your arm on his shoulder or on his elbow or somewhere like that. So it's a soft patting effect can control the baby than your scolding or abusive words. So physical contact, that too a loving contact, is a major mandate for managing these ADHD kids. Teach only when the child is motivated for the studies, and otherwise better to attract him to the task mentioned. And regarding the cognitive behavior therapy, and it's a therapy given by a behavior therapist or psychologist. It's encouraging an active participation in the learning and monitoring process. It's actually training the baby to do so. And that's regarding the impulsive behavior also, they have to train such thing. So regarding that, from an Ayurvedic practitioner's desk, it's a pharmacotherapy which we are supposed to do, and it's under the guidance of an Ayurvedic practitioner, where we should arrange for this educational management. We should give instructions for the teacher, so how to care for the baby. We should give proper instruction for the parents for caring the baby at home during each and every activity, and also during the class, and giving instruction for the CBT therapist or behavior therapist. And along with that, we should do our Ayurvedic management, both internal medications and Panchakarma therapies. So it's a combined effort by a team of actually relatives, teachers, therapists, behavior therapists, CBT therapists, and the pediatrician or an Ayurvedic doctor. Considering the signs and symptoms of ADHD, it mainly comes under the spectrum of Unmada, where almost all the child psychiatric disorders are dealt with. So while considering the signs of Vardika Unmada, it is told that Asthane, Rodana, Akrosha, Nartanam, Stimida, everything. The baby or the person is dancing or talking excessively or crying at inappropriate places. That's emotional instability is the main feature of Vardika Unmada, which comes as a major component in ADHD. And excessive motor activity, Ajasra Matana, again, and a main feature of like running here and there. Excessive motor activity, excessive talking, and usually the baby is due to the excessive physical activity, the baby will be usually lean. And anger is a main feature because many of others are denying his activity or blaming him for not sitting quietly. So anger is the disruptive behavior. Santarjanam is also a main feature. So from an Ayurvedic platform, we can consider it as a Vata Paitiga Unmada. So features of Vata and Pitta is dominant, and Kabak Shaya is also seen usually. And next, coming to the autism spectrum disorders. Autism spectrum disorder. So, to sum up, the ADHD is actually three cardinal points are the attention deficit, hyperactivity, and impulsivity. So, we'll be considering it as Vada Paitika Unmada with Kapakshaya Lakshana. So, coming to the next common disease in Ayurvedic psychiatry is autism spectrum disorder. This is one of the most severe neurodevelopment disabilities in children, and it is an alarmingly high prevalence rate. You can see that frequency curve of autism spectrum disorder. This was plotted by CDC from USA. They have a clear plotting, like it was the frequency was or incidence rate was 1 in 5,000 only. Only one baby in 5,000 kids were diagnosed with ADHD in 1975. And after 10 years, that is 1985, it came like 1 in 2,500 are affected with ADHD. And another 10 years, it came like 1 in every 500 kids have ADHD, autism. Another 10 years, then 2005, it came like 1 in 150 as ADHD. And it's in 2015, the prevalence rate is like 1 in 132 kids are having ASD globally, and USA it is like 1 in 59 or 60, and India is bit behind, 1 in 83. It's babies are having autistic features. So it is an alarming increase in the prevalence rate is reported in ASD with a classical triad of symptoms. The main three features are baby doesn't have any social interaction with the parents, won't be having social interaction with the kids of the same age, won't be having a positive or negative interaction with any of the, they'll be just ignoring the other people, and they'll be behaving as if they are in a world of their own. That communication will also be impaired. They won't be having any verbal communication. And moreover, they won't be able to understand our communication also. That's a major problem. They won't be understanding our language, and they won't be paying attention to our non-verbal communication also. If I call him like this, even if without a language, you could have understand that, but he won't be regarding that. And loss of eye contact is also a major feature. And along with that, stereotypic behavior and interest is also noted. Stereotypic body movements like hand flapping movements or hand wave, like seeing a peculiar acting like this, or rocking movements, everything. Stereotypic movements, even they don't know how to play with that toy. So it's a defective disorder where he doesn't know how to live in this world. Even he is hungry, he will be crying like anything. He won't know how to ask for the food, or such an aloof condition. Baby is an aloof world actually. Regarding the pathophysiology of autism, genetic factors play the major role. Many chromosomes or many genes have been identified to play a major role in the etiology of autism. Along with its genetic defects, many structural and functional changes in the brain is also being plotted out. Still, many researches are being conducted worldwide in the field of autism due to this alarming prevalence rate, and the modern or conventional medicine is lacking to find a solution or effective management for autism. So it's the most hot field where major researches are being conducted, and many have come up with plotting that many neuronal organizations or neuronal interconnections in the brain are defective, and the brain is functionally impaired to process many of the information, especially regarding this auditory impulses. When we hear a sound, the baby is able to hear and appreciate that sound, but he is unable to process that sound and understand the meaning. So he cannot, the receptive language area is defective. Even though he can hear that sound, he cannot convert that sound into a language and meaning. And many metabolic factors are found to be defective. He is finding difficult to digest many proteins, many enzymes responsible for the digestion of protein is also defective. So, and again, an involvement in immune system is also noted there. And many environmental factors have known to precipitate this impairment, like increased screen time, refrigerated parentage, that lack of love or affection from the parents, etc., has precipitated the condition. But main pathology behind is a genetic factor, that functional impairment of the brain, and the metabolic factors underlying. CNS pathologies, I think I will skip through. And regarding the metabolic factors, which we are of the major concern, metabolic pattern or digestive assimilative mechanism in the baby is defective. And the gut microbiome, I think almost all will be familiar with the gut microbiome. Our intestine mucosa is filled with many bacteria, many organisms, which forms a thick packing like. And these bacteria are responsible, this microbiome may have healthy organisms and unhealthy as well. And this microbiome is supposed to form an intestinal mucosal barrier so that only digested material can get in. So in the intestine, our food we eat is supposed to get digested into micromolecules, and this micromolecules is supposed to end, only these micromolecules are supposed to enter into our circulation. And this microbiome helps in forming a filter mechanism so that only these macromolecules are absorbed into our systemic circulation. All other macromolecules or undigested food material will remain as such in the intestine. In this autistic kids, this intestinal mucosal barrier is compromised. Mucosal barrier is compromised means the gut, that capillary mechanism or endothelial mechanism in the gut is defective. So its gut can leak out, means macromolecules, which is semi-digested food particles inside the gut, can leak out through this mucosal barrier and can enter into the systemic circulation. That is acne mandya, which is happening in the gut, and the food is digested only to the macromolecular level, and this undigested food matter, that is macromolecules, can leak out into the or get into the systemic circulation via systemic absorption. So increased permeability of this intestinal mucosa leading to gut leaking, that gut is leaking out. And especially regarding the gluten and casein, the baby is finding very difficult to digest this gluten and casein. Casein is the milk protein and gluten is the main component in the wheat. So the semi-digested food particles in the intestine is getting absorbed in the systemic circulation. So these semi-digested food particles entering into the systemic circulation, they don't know what to do. Actually, they cannot be converted into energy or ATP, and they haven't completed the full cycle of metabolism. And usually, these semi-digested food particles, that is gliadomorphins or casomorphins, they mimic the structure of opioid hormones like beta endorphin. So, body will recognize these undigested food particles as an opioid hormone, and these undigested food particles in the systemic circulation has an easy entry into the brain by crossing the blood-brain barrier. So, these macromolecules or undigested food particles mimicking the structure of opioid hormones is entering into the brain circulation. So, see how the brain will be recognizing this as opium intoxication and will perform a behavioral abnormality as if the baby is intoxicated with opium. And this will alter the neurotransmitter levels in the brain as well. So, this gut mucosa is responsible for formation of serotonin, and which is the main neurotransmitter which is responsible for the emotional balance, happiness, sad, that emotional balance of the brain or system is maintained by the serotonin, and this serotonin levels are also altered. So baby will be exhibiting socio-behavioral problems. This is the pathology behind. So social behavioral problems which the baby is exhibiting will be lack of eye contact, no peer relation. The baby won't be playing with the kids of same age. The baby doesn't want to be cuddled or pampered, ignores other people, prefer to be alone, aloof. Sustained odd activities or sustained stereotypic activities will be the, you won't be getting a good sleep. And he will be resisting to any change, any change of dress, a change of food style, everything he will be resistant to, having temper tantrums, and even the baby will be biting, self-injurious behavior will be that. So Ayurvedic perspective regarding this behavioral abnormalities, we can count under the spectrum of Unmada. I tried to narrate that pathophysiology in detail, in similarity with the Unmada pathophysiology. Actually, the pathophysiology narrated in autism spectrum is can go very parallel with the Unmada spectrum, because this metabolic derangements are there. So Ahida Annapana will be precipitating these autistic features, and every disease can precipitate. So Visha, Upavisha, everything can precipitate the disease. So concerns in Ayurvedic platform while managing an autism spectrum disorder is this defective acne. Baby has a defective acne, so defective digestion and metabolism is the accumulation of this semi-digested food matter is the in the intestine, which we can call as ama, amatva in the intestine or koshta, and systemic absorption of this amatva through that leaky gut, that is systemic absorption of that ama from the koshta, I can call when it reaches a systemic systemic circulation, I'll call it as Dadugada ama or Resagada ama. This Resagada ama can reach Mastulunga Majja, altering the structural and functional maturation of Majadhadu or brain, imbalance in the three doshas with predominance of Vada, impairment in the functional level of mind or brain, especially regarding the temporal prefrontal cortex. Then improper perceptive skill, that Jnanotpatti Kriya will be defective. That is how even if he hear that sound, he won't be able to interpret that sound into a meaningful language. That is auditory interpretation area won't be working properly. And coordinated functions of Manas and Sharira will be altered. So the management protocol will be, from the baseline we have to correct it up. So improve the digestive and metabolic functions of the acne in the intestine, correct with the acne deepener drugs, and prevent the gut leaking. And now, even though we have prevented the gut leaking, we have to detoxify all these toxic elements which had entered systemic circulation well before. So systemic detoxification is the needed. So our next aim is to clear out the metabolic toxins crossing the gut mucosa and entering the systemic circulation, that is removing the ama visha by way of pajana and snehana, followed by virechana. We will attract this ama visha from the systemic circulation into the gut, and we will remove it from the gut by virechana. Then dietetic regulations to foresee that his acne is impaired, genetically his gut acne is impaired. So food items which are leku should be advised, and all guru things like these milk products, milk protein, then excessive guru like heavy proteins like cashew nut, pista, badam, everything should be cut down. Better to cut down that gluten use by reducing the intake of wheat and wheat products. Now, after removing the detoxification, we have to establish the equilibrium of doshas, especially Vadashamana should be the, and Rogadhisthana is Shiras. So, importance should be given to Nasya and Murtadaila for the management protocol, and along with that, behavior therapy should be given. So autism spectrum disorders can be viewed as a Kapavrita Vada. In some cases where hyperactivity is associated, we can include it, the Pitta Anubandha in that. Attention deficit disorders can be viewed as a Vada Paitiga spectrum. Typical ADD with attention deficit alone can be viewed as Vadiga dominant Unmada. Mental retardation, that is cognitive defects, can be Vada Kabacha with Kapha Avarana type. Temper tantrums in a Paitiga protocol and all. So our major concern is correcting the Agnimandya, correcting the Ama, correcting the Sroto Shodhana. Then Thadu Sthirata, Thadu Shaidilya should be maintained. Then also consider the age of the child, the drug tolerance, and usual association of seizures in ASD. So evaluation, before planning a treatment protocol, we have to evaluate the severity of cognitive behavior disorders. So IQ test, then autism severity test, cause and attack, ADHD severity tests like Conners, ADHD T2, and regarding the major other child psychiatry comes under the learning disability and associated issues. It can be dealt with NIMHANS, SLD battery, tower, talk, prefab, etc. Then usual association of seizure is there in child psychiatry. So better to go for an EEG, functional MRI if possible, and metabolic screening, and can go for the neurotransmitter level evaluation as well, especially regarding serotonin and melatonin. And always regard the involvement of gut-brain axis, because we have to correct the gut and then reach the brain. Otherwise, our medications directly for Methya medications directly into the child psychiatry won't work well. So correct the gut first, clear out the metabolic toxins, and then do a Methya treatment. So they should adopt a Deepana Pajana, Mrudu Shodhana, Patyahara, Vihara, and then address the deranged doshas. Shamana Aushadha is our best choice because the age is contraindicated in the child psychiatry. It is usually contraindicated for major Shodhana procedures. So you have to weigh judiciously the benefits of Panchakarma therapies against the potential risk of pediatric age group and the disease condition. It's not contraindicated. Snehabana is mandatory after Deepana Pajana. Usually in Rasomatra or Vicharana you can do as well, which is baby friendly. Hridas having a targeting action in the brain can be selected for that. Then Bahya Snehana, like Sthanika Chilsa, like Murthadaila can be, should be included as well. Like Shiro Pichu, Shiro Dhara, Shiro Vasti can be used. Regarding the age limit of the child, it's tough to do the Shiro Vasti. So usually go for Shiro Pichu and Shiro Dhara as well. Then Shiro Lepa, this application of medicated paste on the scalp, have wonderful results in the management of these child psychiatric disorders. So Shiro Lepa can be of two types, that's Pitta Shamana Shiro Lepa and Vadakapa Shamana Shiro Upanaha. That's a Sveda which can be done in the Shiras as well. This one is Shiro Lepa. This one is told in the Kerala, that is Kerala classical textbook like Arogya Kalpadruma. It's very effective, very nice collection of practical yogas which contains and a special session for child psychiatry as well. This is Bella Sokaladi Shiroleba, which is as directly narrated in Arogya Kalpadruma, which is very effective in managing hyperactivity associated with ADHD as well as in autism spectrum disorders. Effective in sleep correction, then temper tantrums and all. Fresh leaves of Bella, that is taken. It's grinded with the fresh leaves of Sohala. It's made into a paste. And Panchagandha Churna along with Krishna Jiraka is added. The powder of Panchagandha Churna, which is readily available in the market, is added with a pinch of Krishna Jiraka. So everything is made into a paste. You can mix it in the mixie as well. Added with butter, fresh butter, unsalted butter, and a bit of milk. You'll be getting a paste like that. You can apply on the scalp as if you are applying a henna also. Keep it for a duration of at least 1 hour. and then wash off. And it's better to wash off with the leaves of bella and panchagata. Again, talam is another that's application of medicated paste on the antifontanan. Very nice in managing child psychiatric disorders. I'm skipping it a lack of time. Shiru Upanaha, another procedure for Vata Kapha Shamana, where Kapha Avarna is more, especially in autism spectrum disorders and all. When Kapha Avarna is more, baby is secluded, aloof, and not having an eye contact with others. We have to, even though Shiras is an Asvedhyanga, we have to do a Svedana in the Shiras, because the condition demands such that. So we select Svedaniya drugs from the Upanaha Gana, make it in a fine powder, and apply as thick paste on the scalp. You can see the Upanaha here, and we cover it with the Eranda Patra, which is again the Ushna Gunatva is the. That is, this is one is Shiroleba, which we cover with lotus leaf. This one is Pitta Shamana, Shida. The other one, Shiropanaha, is Kapha Shamana and Ushna. Again, the role of Kashayavasti in management, psychiatric management shouldn't be disregarded. It has a major role as well. Again, Nasya is a powerful potential tool in the management. In Vadapaitya condition, Shirabala Nasya is always sought for, especially in anxiety, neurosis, ADHD and all. When in speech disorders, cerebellar and extrapyramidal lesions, Dhanvantaram Vastidailam is sought for. And Varanadik Shirakradam is readily available in the market, is the best option regarding impaired sociability, mental retardation and all. Again, Mananasyam is another tool in breaking that avaranato of Kava, especially in emergency situations. Thubana, even though Thubapana is contraindicated in children, Thubana of the fumigation of the room is very nice in managing psychiatric disorders, because it's stimulation of the olfactory bulb and the stimulation of the brain is highly sought for in such psychiatric management. So this the snaps where the babies are undergoing Shirodhara and all. Again, Chirolepa and Nasya. This is a case profile. Let's just skip through. This is a baby aged 5 years having an autism spectrum, diagnosed to have an autism spectrum disorder. This case is being discussed in this platform with the consent of the parents. See the meaningless eye contact which is having, just meaningless face, expressionless face is having. You can see the video. Not at all affectionate to the parents, he is trying to run away. His mother, this is father. He is trying to poke his little finger into that electric cord. Not having a social interaction or positive attitude with that parents. See how he is climbing. He doesn't have that pain sensation. So the complaints of hyperactivity, temper tantrums, lack of attachment to family members, failure to develop peer relationship, and social emotional reciprocity were noted. We did the Deepana Pachana, and social impairment was the main feature. We did Achapana, Mridusvedana and Virechana. Shamana Ushada and improvement noted after 2-month period. This is a picture of the same baby after 2 months of management. He can respond if called with a name, can follow some commands. See the difference in the face. As a strong eye contact. See the difference in the face before and after. I didn't mask the eyes because of this. You should note the difference in the expression of the eyes and the face. This is the video after 2 months of management. See how he is attached with the parent. Just a case report to show that the efficacy of Ayurvedic management, especially in an autism spectrum. This is another research study to show the efficacy of Ayurvedic intervention along with behavior therapy in ADHD. We did a experimental study on that. And two groups of kids were divided in two groups. One group was set as a control, and the other group was an experimental group. The control group was given behavior therapy alone, which is a conventional management in ADHD. And the experimental group, we gave Ayurvedic treatment protocol along with the behavior therapy. And the inclusion criteria was all children kids between 5 to 12 years, satisfying the terms and conditions of satisfying the ADHD criteria. And exclusion criteria, we excluded the mental retardation, childhood epilepsy, and all. Black box design, that's a compact design of as narrated in the WHO panel was given, along with the diet and acne correction and physical exercises. Tiktaka Krida, which is having a Vata Pitta Shamana quantity, Shamana property was given, along with Panchatiktaka Shirathara for 7 days, and Shirodhara with Shirabala for 14 days, and Shiroleba, as I narrated, Bella Sola, the Shiroleba was given 14 days, followed by Mustadi Rajayapanavasti. Only this much medications was given, and the assessment criteria was assessment was done by a psychologist, expert psychologist, regarding the ADHD T2 criteria, and parents did an assessment with the parental rating scale, that is Conners, and the intervention period was for 2 months and a 1 month follow-up. And this is the result before and after treatment. It was highly significant before and after treatment. So you can see that reduction in the parental rating scale. This just before treatment, after treatment, and this one is after follow-up. ADHD T2, and that's after treatment and after follow-up. So the Ayurvedic treatment protocol is very effective in reducing the signs and symptoms of ADHD, especially in kids under 5 to 12. Thank you. This only I know I could cover only 2 topics in the child psychiatric, but in this limited time, any queries in this regard is highly welcome. I am happy to interact with you as well. Thank you.
Thank you so much, ma'am. Ma'am, you explain very well. Actually, this is very common disorder or very common problem nowadays. So it will help us to treat patients if they approach to us, ma'am. Thank you so much.
Yes. So thank you very much, ma'am. As per your time, it was really good. So हम लोग थोड़ा डिस्कशन करते हैं, तो मैं सभी डॉक्टर्स यहाँ पे जो भी उपस्थित है उनसे मैं रिक्वेस्ट करूंगी, कुछ अपने क्वेश्चंस हो तो वो डायरेक्टली भी पूछ सकते हैं या फिर चैट बॉक्स में भी लिख सकते हैं। तब तक हम लोग केतकी चेयरमैन सर है, उनका भी परिचय दीजिए। सर जुड़ चुके हैं।
जी मैम। आज के हमारे सेशन के चेयरमैन है डॉक्टर राजीव जी, और उनका मैं परिचय देना चाहूंगी। मेरी आवाज आ रही है?
हाँ, यस कंटिन्यू। यस कंटिन्यू।
जी मैम जी। चेयरमैन है डॉक्टर राजीव कुरले सर। राजीव सर एसोसिएट प्रोफेसर है देहरादून उत्तराखंड से। वेलकम सर टू आवर सेशन।
सर नमस्कार। सर एसोसिएट प्रोफेसर है यूएयू देहरादून रसशास्त्र डिपार्टमेंट में, और काफी एक्टिव रहते हैं सोशल सभी प्रोग्राम्स में। और यहाँ पर आज हमें एक्सपर्ट या चेयरमैन के रूप में यहाँ पर सर हमें अपना कुछ यहाँ पे एडिशन भी देंगे इस सब्जेक्ट में। यस डॉक्टर कुरेले सर। सर आप बोलेंगे?
हेलो राजीव सर। सर सुन पा रहे हैं सर हमें?
मैं ये कर देती हूँ। यस सर, अनम्यूट कर सकते हैं अभी आप। डॉक्टर वंदना मैम आप बोलिए तब तक, सर शायद।
मैडम आपका जो आज का सेशन था डॉक्टर रोशनी मैम, it was wonderful and although it was a little too fast to थोड़ा जल्दी था because टाइम की लैगिंग थी। और अभी हमारे जो श्रोता है, मेरे इधर थोड़ा सा डिस्टरबेंस है, तो जो हमारे व्यूअर्स हैं उसमें एक पेडिट्रिशियन भी जुड़ी हुई हैं, डॉक्टर श्रुति निगम। So we will ask her to ask some of her the questions. Regarding myself, I would thank you, ma'am. You have given very nicely. पूरा बहुत अच्छे से आपने बताया। मैं बस ये पूछना चाह रही थी कि बचपन में अगर किसी को कोई प्रॉब्लम हुआ, यानी कि उसने कोई सुसाइड देखा घर का और कुछ डेथ हुए, उसके बाद डायग्नोसिस काफी लेट हुई, यानी कि 21-22 इयर्स पे जाकर उसमें बिहेवियरल चेंजेस आए, तो जो उसकी पुरानी हिस्ट्री थी उसी की तरीके से हम उस यंग बॉय का क्या वही ट्रीटमेंट उसी तरीके से स्टार्ट करें, और उसको यानी कि वो कभी हंसेगा, कभी तो अच्छे से नौकरी करता है, कभी छोड़ के आ जाता है, और कभी कभी वो कुछ रामायण और गीता के वो भी सुनाने शुरू कर देता है। तो लोग बाग हैं वो ये सोचते हैं कि शायद जो है वो कोई ग्रह बाधा है उसके ऊपर, और उस तरीके से भी सोच के दैव व्यापाश्रय भी कर रहे हैं साथ में। बट मुझे लगता है कि आपका लेक्चर सुनने के बाद कि शायद जो आपने पूरा लाइन ऑफ ट्रीटमेंट दिया है आज का, कि हमको उसका पूर्व कर्म करें, शोधन करें, डाइट करें, इक्विलिब्रियम ऑफ दोषास करें विद शमन औषधि, और उसके जो नस्य दें, उसके जो बिहेवियरल थेरेपी दें, तो मुझे लगता है कि उससे काफी हद तक रिलीफ आएगा। आपका क्या कहना है मैम, इस बारे में बताइए।
At this later age, like after 20 and all, it won't be usually linked with genetic issues. It will may having another some precipitating, like comes under the mood disorders or obsessive disorders or schizophrenia also. But our treatment plan will remain the same, madam. We have to see which dosha is involved. If it's more related with temper tantrums and he is having more anger and all, can you usually attribute Paitika Bhava in that. Usually when we attribute for the Vadika Lakshanas, it will be like quick, fast thinking, and he'll be distracted. He can't have a fixed name for his activity. He'll be having, he'll be thinking one thing at a time and slow, usually distracted in that activity and having another thought in between. He won't be organizing, able to organize in his thinking capacity. He won't be able to plan his activity. Then it's like more of Vadika nature. In the other Kabacha spectrum of psychiatric disorders, it will be most depressive moods. He'll be not liking to interact with others. He'll be having more inferiority feeling. So getting aloof, not speaking out his issues, or hiding all his problems. That comes under the Kabacha spectrum. So it's regarding the dosha dominance, we have to first analyze which dosha dominant is there in the present scenario. It's not regarding his past involvement. Samprapti might have taken, had it course in the long past, but we have to analyze the dosha in the present scenario, madam, and go for a gut correction, which is mandatory, because every abnormality in the Manovasrodha will have an abnormality in the gut first. So go for the gut correction, do Deepana Pachana, do for dietetic regulation, exercise, yoga is mandate. And after that, assess the dosha involvement in the present level. If it's like his mood fluctuations are more, and sometimes he is chanting the Bhagavad Gita, and sometimes he is having another aim also. So you should regard it fluctuating or Vadiga Charatva in the Vada more. Chara Sopava is Vada, and Chala Sopava is Vada is more appreciated that. Then it's better you go for a Vada Shamana treatment after the gut correction and all. And you should treatment procedures or Panchakarma procedures which has a direct action on the shiras like Murtadaila, That is Shiro Abhyanga, Seka, Vasti, and all should be are having very additional benefits. And among these Shirodharas and all, this Takradhara is having more Shodhana property. So if we can go for a Takradhara first, and then plan, then if it's more Vaitika involvement, we can go for a Kshiradhara after. And go select for a Snehana like Tailadhara only as a last resort. Don't directly go for a Snehana procedure. Better go for a Shodhana, then a Shamana, and then only go for a Snehana procedure. Even if in the Bhakya procedure or external procedures or in the internal, so we should go in that pattern. Takradhara is having a very Shodhana effect, and it will be beneficial in such disorders. And if we can process the Takra with more Vadashamana properties or Satnya Sthabana Gana and all, it will be very effective in such cases, ma'am. And regarding internal Snehabana, I think Panchagavya Krida will be very effective in such a case where that fluctuating those thoughts are there. Am I clear, ma'am?
Thank you so much, ma'am. बहुत अच्छा बताया आपने. And इसी के साथ I welcome Dinesh sir and thank Dr. Ketki for singing such a beautiful Vandana after every program, and Dr. Ved Rajiv Purela ji, and of course organizer Shilpa ma'am. She is the most active person. Thank you, ma'am, for organizing. Roshni ma'am को बुलाने के लिए. And I think other viewers would like to have their questions right now.
Definitely.
Please
Yeah.
take the
One
mic.
question is there.
One question
Facebook.
from me. Can I ask?
Ketki. Yeah.
Yeah, ma'am. Rohini, ma'am, actually one question is there. One patient came to me. She's having age of 3 years only. And Hetu, I found she's having delayed milestones. Now she can talk properly, but writing issue is there with her. And in Hetu, I found after 7th month of her mother's pregnancy, her, what we can say, nutrition or her growth a little bit not stopped, it retroward, it पूरा नहीं हुआ वो growth उसका. So she was underweight, I think 1.8 kilo, something like that, or less than that. And after that, for 6 months, she delayed 6 months her milestone, 6 months to 8 months.
Okay.
So now everything is normal. She can talk properly, but writing issue is there. And sometimes she says repeatedly same sentences. So how to diagnose that patient and what will be the line of treatment? Can you please tell me, ma'am?
Sure. This is a case of intrauterine growth retardation, ma'am.
Yes.
I think that baby was only 1.8 kilos, and
Yes.
especially 80% of the growth of the brain happens in utero, and that 80% growth has been compromised, isn't it, ma'am? So it will be showing some reflections in the later life. If we are able to support that Dhatu Poshana with our drugs, it will be very, very effective in the clinical management as well, ma'am. We have to have a proper diagnosis of the present scenario. Whether the problem is writing is regarding that motor coordination of that fingers, or he doesn't know how to write or what to write. Regarding the speech also, I think you told that echolalia is there. She's repeating the same sound, same words.
Yeah, sometimes. Yes, sometimes.
So maybe she doesn't know what to answer or what to say in unexpected moments. She may be by hearting, what's your name, what's your father's name, everything she will be by hearting. Nothing, no problem regarding the memory, but she won't be able to answer your questions, unexpected questions like maybe how did you come over here, कैसा आया इधर तक, मम्मी के साथ आया या पापा के साथ, ऐसे पूछने पे हमें पता चलेगा कैसा है, या untrained faculties वो आंसर बता कर सकते हैं कि नहीं.
Yes,
so it's better to you analyze the speech of the baby. Because the speech area is very near by that learning area, learning disability area is very near to that speech area. So maybe that writing defect is regarding her as a feature of learning disability. Usually these two go hand in hand.
And she is still underweight, ma'am.
Still underweight. Then it's clear cut. Our management protocol should be like that of Shosha, Kumara Shosha. Give Deepana Pachana drugs, the strict dietetic regulations regarding advice, more soups and all. Cut off all vegetables which are growing underground. The tubers should be avoided, like carrot, radish, beetroot, everything, and tapioca, everything like should be avoided. Then more leku ahara, then fruits also leku having, and cut off all these products made of white flour. That bakery junk food should be strictly regulating. No biscuits, bread, then paratha, everything should be cut off. And you can select porridges which are having very leku quality. And this Mutka Yusha is very nice. Or if they are habituated with non-veg, then also soups are very advised regularly, can be advised regularly. And the Agni Deepana drug, like we usually advise Ashtachurna or Hingoshtaka Churna daily for such babies. Then Kridas having Srodoshodhana capacity like Shatpala Krida or Induganda can be given in the initial phases. By the time, madam, you can analyze whether the baby is having the features of learning disability and you can analyze the speech, the defect which she is having in the speech. Then slowly after correcting the baby's nutrition, we can target the Tikshna Methya drug should be given, I think. No other behavior abnormality and Tikshna Methya means Vacha. Drugs which are having Tikshna Methya drugs can be included. This Saraswata Churna or Kalyana Gavaleka Churna is having very nice, along with Vacha Churna is having wonderful results. Can rub it on the tongue and give us Avaleka as well.
Okay, ma'am. Thank you so much, ma'am.
One question from my side also, ma'am. आजकल बहुत ज़्यादा we see the patients, number of patients of obsessive compulsion disorder. Can you do something in as per Ayurveda? Like this is often happens with the persons like कुछ भी करना होता है. जैसे मैंने कुछ लोगों को देखा है, जैसे बहुत ही मेरे मतलब इस परिवार में भी या कुछ ऐसे कि कुछ एक हैबिट लग जाती है, जैसे दरवाजा बंद करना है. एक इसको भी देखा था मैंने कि पानी से उनको प्रॉब्लम थी, तो वो लाइक कि पानी के हाथ मतलब हाथ धोती थी ना, तो वो मतलब उनको समय ही नहीं लगता था कितना समय जमे जा रहा है. उसको ऐसे बार बार लगता था कि मैं बार बार हाथ धोऊं, मेरे हाथ निकले ही नहीं, साफ नहीं हुए. तो आधा घंटा 1 घंटा कितनी भी देर वो मतलब हाथ धोती थी, पानी से उनको ये था जब भी. तो फिर घर वाले उसको बहुत संभालते थे कि पानी जब आता था तो पानी के यहाँ पे जाने नहीं देते थे. तो सच टाइप ऑफ इश्यूज लाइक दरवाजा लगाना, तो 1 बार नहीं लगाना, 2 बार लगाएंगे. वो एक हैबिट बन जाती है कि 2 बार लगाओ, 3 बार लगाओ. एक को मैंने सुना था कि वो कुंकू लगाता है ना हम लोग पूजा करने के बाद, तो कुंकू लगाना 1 बार लगाते हैं. तो उनका ये सोचना था कि मैं 3 बार ही लगाऊंगा, तो एक बार लगाने से अच्छा नहीं होगा, तो 3 बार की आदत लगे तो 3 बार लगाना. ये रिपीटेटिव टाइप ऑफ एक्शंस. सो इसमें मुझे बहुत बार ये कॉमन हुआ है आजकल. थोड़ा मतलब डिप्रेशन है या ज्यादा सोचना है उस चीज को लेकर, मन में कुछ बैठ जाता है कि मैं ये ना करूं ऐसे तो कुछ होगा, या व्हाटएवर मतलब डर है क्या है. आप थोड़ा इसके ऊपर भी चर्चा करेंगे तो बेटर रहेगा.
Yeah, OCDs, obsessive compulsive disorders, the Vatika component is more. That stereotypic movement, that repetitive compulsive movements, everything comes under the Vatika spectrum. So we have to address that Vata straightly, but you shouldn't go for a straight Brahmana therapy over that. It won't be effective. Go for an Avarana is a bit of Kabha Avarana Vata is the. So go for, as I told earlier, for every management of all psychiatric disorders, have the Deepana Pachana, gut correction, then detoxification is mandatory. And then what I am telling is that Vada Shamana, Brahmana Vada Shamana can be adopted over the Snehana is mandatory. In the initial phases, Kalyanaka Krida is a better option over the in OCDs. Then first initial Snehapana with Kalyanaka Krida and external applications. Takradhara in the initial phase, then go for Nasya. That is, if he is an adult, you can directly start with the Pradimarsha Nasya and then go for Marshatasya. Especially in that cases, initial phases, Dhanvantaram Nasya Taila, Avartita Nasya Taila is very effective. Start with slow, our minute avarti is like 7 avarti also. Slowly increase the dose of Marsha Nasya. Then on the head application, you can go for Shirodhara. That too, Dhanvantara Taila is the best option. If it's associated with a bit of aggressive nature also, can add a portion of Chandanadi can be added along with that, only a small portion. If there is aggressive behavior or if it's getting angry so often, otherwise Dhanvantara Taila, and other option is Mahanarayana Taila is very nice for Shiro Abhyanga and Shirodhara as well. Then Shiro Upanaha, which I told, I have discussed earlier, is having wonderful results in the management of OCD. That is covering the scalp with drugs having Ushna Svedana property, because it's a Vada Vyadi, it demands a bit of Ushna treatment as well. So covering the scalp, keeping the drugs powdered, mixing it with takra, then making a bit lukewarm and applying it on the scalp, covering with it air and a patra for 1 hour, keeping it as such. I usually do a Pradimarsha Nasya with Varanadik Shira Krida after this Shudobana. Varanadik Shira Krida is Varanadi Gana. Varanadi is Kavam Medo, Mandak Tipson Niechadi, Atyavadam Shira Shulam, it is indicated. And so it's very nice in removing the avarana of this kapha and regulating or freeing off the vada functions. It's very nice. It can be used as pradimarsha after this Shirobana.
Okay, ma'am.
OCDs can be well managed with our medications.
Any other like psychological counseling and other sessions are necessary for such?
For all psychiatric cases, it should be supported by with a behavior therapy as well. In children, it's behavior therapy. In elder one, it is counseling. Either you can, if you are trained enough in the counseling and all, you can do it. Otherwise, if you are not so well versed in that, you better seek a help of a psychologist for that, not psychiatrist. You should seek the help of a psychologist and give direction that this is a condition which we are giving. We are giving management for that, and so have an 1 or 2 hour sitting per week.
Ma'am, question is that how to stop their repetitive actions, because
the repetitive action is like this. It should be stopped all on a sudden. Their mind is there. They feel like doing it very often. That feeling should be managed so that they will stop. It's not that you shouldn't say that you shouldn't do it anymore. There shouldn't be a compulsive stopping. They will stop by their own.
Okay, that's the problem. They should realize that they are doing this such type of things. So they must stop by themselves.
Effective thought which is happening, or obsessive thoughts which are happening, we shouldn't be intruding or negating it like you shouldn't do, or if you do like that, no need of threatening or anything like that. They should realize that what the defect they are doing. The job of the psychologist is that they'll be mirroring them. They'll be realized, the parents, patients will be realizing that, Are Baba, I'm doing like this, what is my, it's too bad. I'm doing the bindi again and again. I'm doing the, keeping that kungum here, it's so bad. He should realize that what is the defect which is happening. And the thought process will be broken with our medications and external procedures, and OCDs are having a good prognosis.
Yeah. Same. I just want to discuss one more. Like nowadays, the children or childs are much more active, very active. And so, is there any medicine to go through that hyperactiveness? Is there in many childs?
Yeah. That's why I was.
Is it a problem, or it could be taken as a normal situation?
hyperactivity or over smartness is not a problem. If the
Yeah.
baby can pay attention and do his
Like
task,
destructive nature. Yeah, destructive nature.
do his task without any hindrance, if he is able to pay attention and complete all his tasks and all his activities in a regular manner, hyperactivity is not an issue. He is over smart. But if he is unable to maintain his attention, he is unable to maintain his task, and he is having a disruptive behavior, he is hurting others or hurting feelings of others, then he should be corrected. He should include the counseling as well, and if it's demanded medication, he should correct it.
Yeah, Dr. Raju sir, please. Sir, your expert opinion, Dr. Raju sir.
साथ साथ चल रहे हैं.
Yes, sir.
हेलो, नमस्कार.
हाँ, sir.
Namaste, sir.
सॉरी, अभी कॉलेज के टाइम में अभी जस्ट जो है, पहले तो आप सभी को बधाई कि आजादी के अमृत महोत्सव में इतना बढ़िया आपने कार्यक्रम किया, और डॉक्टर साहब ने बहुत ही अच्छा बच्चों के बारे में बताया. और बच्चों का मन, कहते हैं बच्चे भगवान का रूप होते हैं, और जितने सरल होते हैं, बस समझने के लिए बस ऑब्जर्वेशन चाहिए होता है एक इनके लिए. और ऑब्जर्वेशन अटेंशन से आता है. ऑब्जर्वेशन के लिए कोई प्रीरिक्विजिट, कोई विशेष वजह नहीं है, सिर्फ बस अपने को दिल लगाना होता है. तो बच्चों को अगर दिल से देखेंगे तो सारी चीजें बहुत सिंपली समझ में आती हैं. बस अपने कुमार व्रत के जो भी सिद्धांत बताए हैं, और आयुर्वेद की जो दिनचर्या, परिचर्या, और मैडम ने तो बहुत ही सुंदर तरीके से डे केयर से लेके सारी चीजें बताई हैं. तो मुझे लगता है कि कुछ छोड़ा नहीं है मैम ने बताने के लिए, कि बहुत ही सुंदर तरीके से बताया. आपको बहुत बहुत बधाइयाँ, और इसी तरह के आयोजन चलते रहें, और हमारे अच्छे एक्सपर्ट हम सबके बीच में आते रहें. तो इसके लिए मैं आप सभी को साधुवाद और धन्यवाद देता हूँ कि आपने हमें सेशन में जोड़ा और इतनी ज्ञानवर्धक जानकारी से अवगत कराया. धन्यवाद.
डेफिनेटली. यस सर, थैंक यू वेरी मच सर. सो अभी एक सेशन बाकी है. सो डॉक्टर श्रुति. यस मैम.
नमस्ते मैम, डॉक्टर श्रुति बोल रही हूँ. आपने बहुत ही अच्छा आज बहुत सारे कॉन्सेप्ट क्लियर हुए मेरे ADHD ऑटिज्म पे, तो थैंक यू सो मच मैम. थोड़े मेरे 2 क्वेश्चन है एक्चुअली. मैंने भी कुमार व्रत से PG किया हुआ है, मैं भी पेशेंट ट्रीट कर रही होती हूँ, तो काफी अच्छा रेट है आयुर्वेद में सक्सेस का. लेकिन मैम थोड़ा सा मुझे प्लीज एक बार, क्योंकि आपने तो बहुत सारे पेशेंट देखे हैं, तो इसलिए मुझे थोड़ा सा आप एडवाइस कीजिए कि जैसे ADHD है मैम, उसको हम वात पित्त मतलब वात वृद्धि ले सकते हैं ADHD में, तो ऑटिज्म में क्या वात क्षय लेना चाहिए हमको, कि यहाँ पे वात क्षय हो रहा है, या हमको वात प्रीडोमिनेंस लेना चाहिए?
Shall I answer?
मैम जी.
ADHD में वाद वृद्धि का लक्षण आते हैं, वाद पित्त वृद्धि का लक्षण आते हैं. इसमें आवरण का कुछ असर नहीं है ADHD पे. ऑटिज्म स्पेक्ट्रम पे आवरण कफ आवृत वादा होता है. कवच लक्षण तो ज्यादा मिलता है हमें, और वाद लक्षण का वाद कर्म का हानि मिलता है. वाद जो है ना, उसका स्वकर्म हानि मिलता है, स्वकर्म लक्षण नहीं मिलता है. सो वाद का फंक्शंस डिफेक्टिव मिलता है हमें. सो कफ आवरण आता है. आवरण जो कफ है ना, उसका ज्यादा लक्षण. दैट्स व्हाई बेबी इज अलूफ, baby cannot have a social interaction, he is not linked, he is not having eye contact, everything. The tamas, the lexan of tamas is more and kapha is more, and we are not getting the proper functions of the brain irrespective of that maturity of that dadus. So
मैम कभी जब हम ऑटिज्म और ADHD या कोई सिंड्रोमिक चाइल्ड को जैसे हम ट्रीट कर रहे होते हैं, या मान लीजिए ऑटिज्म, ADHD और CP के चाइल्ड को जब ट्रीट कर रहे होते हैं, तो जनरली फर्स्ट यही सोचते हैं कि माता से जो मातृज भाव आए हैं, क्योंकि जो हमारा है मज्जा धातु पे, तो जो भी हम काम करते हैं, जितने भी जैसे हम तो BBB को क्रॉस करने के लिए जनरली घृत ही प्रोवाइड कराते हैं. दीपन पाचन तो है ही, मृदु शोधन करने के बाद नस्या, ये सब चीजें ऑब्वियसली जो नस्या चल रहा है या जो शिरोलेप चल रहा है, ये सब चलता है. लेकिन घृत का कल्पना बहुत अच्छा है जो BBB को क्रॉस करता है. मेरा यहीं पे ये वाला आ जाता है. जैसे आज आपने एक चीज बताई, ऑटिज्म फिर भी सबसे डिफिकल्टी से ट्रीट होता, ADHD वगैरह तो हम फिर भी बहुत इजीली कर भी लेते. तो जब ऑटिज्म के पेशेंट है जिसमें आपने आज गट लीकिंग बताया, ये बहुत बहुत न्यू, बहुत ही अच्छा कॉन्सेप्ट मुझे लगा। तो मुझे बस यही कि जैसे हम यहाँ पे जब घृत कल्पनाएं दे रहे होते हैं, तो जैसे कफावृत वात लेके चलते हैं, तो फिर यहाँ पे पहले हमें कफ की चिकित्सा करनी पड़ेगी ना, तो मतलब घृत को हमको क्या सेकेंडरी उसमें देना पड़ेगा। आप समझ रहे हो ना कि जो पहले आवरण किया हुआ है उसकी पहले हम चिकित्सा करेंगे। तो पहले कफ का, जैसे ये गट लीकिंग में आप आम की उत्पत्ति बता रहे थे, तो ये फिर पूरी धातुगत चला जाता है, तो पहले सारा आम का शोधन करना चाहिए हमें। और क्योंकि एडीएचडी में फिर थोड़ा सा ट्रीटमेंट का जो प्रोटोकॉल है ना वो चेंज, वही मैं आपसे पूछना चाह रही थी कि थोड़ा सा ट्रीटमेंट प्रोटोकॉल चेंज हो जाएगा। इसमें पहले हमें कफ का शमन करना पड़ेगा और फिर हम वात पे ध्यान देंगे क्या, क्योंकि जैसे आम की उत्पत्ति हो रही, गट लीकिंग हो रही है, जैसे आपने आज गट लीकिंग बताया, तो क्या इसको प्रिवेंट करने के लिए हमको कोई मेडिसिन इसमें ऑटिज्म में एक्स्ट्रा देते हैं क्या आप? क्योंकि वो एक बहुत अच्छा हो जाएगा, मतलब शायद उससे और ऑटिज्म के पेशेंट मेरे भी बहुत अच्छे से ट्रीट हो सके, क्योंकि 6-7 महीने मैम मैक्सिमम 1 साल तक लग ही जाता है ऐसे पेशेंट्स के ऊपर सारा वो करने में। तो क्या ऐसा करना चाहिए क्या, ये गट लीकिंग को प्रिवेंट करने के लिए कोई कुछ ऐसा आप मेडिसिन वो करेंगी, या हमें आम पे ही काम करना चाहिए
पहले गट लीकिंग पे काम करना है। गट लीकिंग करेक्ट होने के बाद हमको वो आम विष पे काम करना है। उसके बाद ही हमें जो ज्यादा दोष है, वह कब ज्यादा है या वात ज्यादा है, उस पे काम करना है। सो पहला we have to correct the gut leaking, the second we have to correct the ama visha, and third only that detect the predominant dosha and dosha correction. Dosha correction without a gut correction won't be beneficial in the clinical practice. So even if the gut leaking alone can give you very nice results, I usually go for a Deepana Pachana with Ashtachurna, then Shattarana tab, it's easily available, or you can go for a bit, in Kerala we go for Nirkundyadi Kashayam and all, which is very
मैम मैंने भी ये दीपन पाचन और अष्टचूर्ण वगैरह यूज किया हुआ है। मतलब मैं गट लीकिंग यहाँ पे लीक हो रहा है, तो क्या उसके लिए कोई पर्पटी कल्पना पहले यूज करनी चाहिए क्या? मतलब मैं समझ रही हूँ सारा प्रोटोकॉल जो हम चला रहे हैं उसके पहले क्या कुछ एक ऐसी चीज करनी चाहिए क्या कि हमें बहुत अच्छे से रिजल्ट मिलने लगे? तो क्या गट लीकिंग के लिए ऐसे कुछ पर्पटी कल्प, स्वर्ण पर्पटी या पंचामृत पर्पटी लीक हो रहा, वहां आपने बोला परमिएबिलिटी थोड़ा सा बढ़ गई है, तो क्या उसको करेक्ट करने के लिए सिर्फ दीपन पाचन से काम चल जाएगा?
सिर्फ दीपन पाचन से काम चलेगा, दीपन पाचन से ही काम चलना चाहिए, because it's a not a short term goal. We have to maintain that corrected gut leaking throughout that life. Otherwise, so I don't use any parpadi in that. I do use with Kashaya Kalpana and this Churna Kalpana. Then regarding management of the Ama Visha, I usually use Vilvati Gulika, which is very effective in managing this Ama Visha and all. Then mild Shodhana and all. We'll go on with that for removing that ama visha.
Okay, thank you, ma'am. Thank you so much, मैम। डाउन सिंड्रोम का या कोई सिंड्रोमिक चाइल्ड का ट्रीटमेंट प्रोटोकॉल क्या ऐसे ही चलना चाहिए, या फिर उसको हमें छोड़ देना चाहिए? मतलब उसको बोलना चाहिए कि हम आपका लाइफ क्वालिटी बस थोड़ा ठीक कर सकते हैं, हम पूरा ठीक नहीं कर सकते क्या?
Never. We can very effectively manage Down syndrome. It's a disease which doesn't have much complications. We already know that the gut brain growth velocity is slow. We have to just boost the brain growth velocity. If you do manage a Down syndrome under the age of 1 year, we start the management. We can almost equate the baby's IQ to like around 80-85. Above 80 IQ is can have a normal schooling as well. So it should be, Down syndrome is a case which we need to intervene as early as possible.
Thank you, ma'am.
Yes, Dr. Anita ma'am, please.
जी मैम नमस्कार। आज आपका सेशन बहुत अच्छा है। थैंक यू शिल्पा मैम एंड थैंक यू मैम। मैम मेरा क्वेश्चन है कि जैसे अभी आपने एडी बताया कि हाइपर एक्टिव होते हैं बच्चे, तो उसमें नसें और वो सब देने के बाद भी हम कितना समय सोचें कि लगेगा पेशेंट को ठीक होने में? और दूसरी बात कि जैसे अभी मैं कहीं पढ़ रही थी कि महामयूर घृत या मयूर घृत का शिरो रोगों में वर्णन आया, तो क्या उसका कोई आप अपना अनुभव या कुछ बताएंगे कि उसको हमें कैसे प्रयोग में लाना चाहिए और उसका कितना प्रभाव होता है? हेलो मैम। My
it's
question,
okay, so-
ma'am, should I repeat or?
No, I'll
It's
answer,
fine.
ma'am.
Okay, thank you so much. Thank you.
Adita,
Yeah,
ma'am,
ma'am.
please repeat your question. There was a patient's call, and I would like to know the question you have put on.
Yeah, sure, ma'am. Hello, ma'am. How are you?
I'm okay.
The question, okay. Question is this: कि जैसे kids who are very active, and how much time with this nasya therapy, with all these things, how much time we should ask patient to take our treatment, and how much percentage we should say, okay, you'll be better by the end of our treatment. Question number 1 is this. Question number 2 is this. Recently, I'm going through some studies, and they are telling that Mahamayur Grit and Mayur Grit have a very good result in Shiro Roga. If we say if it's a Kaf Avaran or the Vata Vriddhi, so do the ma'am have some experience regarding Mayur and Mahamayur Grit, and what is the role of it? And I want little bit explanation about it from ma'am only. Thank you, ma'am.
Regarding the first question, how
Ji.
much percentage of improvement we can guarantee and within how much time limit?
Yeah.
Actually, that question depends upon the age of the child and severity of the disease. So, regarding the ADHD, it can have, we can assess the severity of ADHD or hyperactivity with different scales, as I think I have narrated it. The most easy one is parental rating scale, which the parent itself can do. It is a free download. You can have it from the net as well. It's Corner's parental rating scale. So you can assess the severity of the condition with that parental rating scale.
Ma'am, kindly spell that. Excuse me, I'm sorry to interrupt.
CONNER, Corner.
Right, ma'am. Okay.
It's a free download scale. It's easily available in the net. You can rate it with the Corner's rate. It's very simple as well.
Okay.
It will take hardly 5 minutes to assess severity. If we are well versed in a psychological management, you can do PACA, classical like ADHD T2 is a scale which I use regularly, and they do have another scale ad hoc. But ADHD T2 is more friendly. If you are thorough with that subject, you can use. Otherwise, Corner itself is enough. If it's more severe, that condition demands more time and more effort. And the another determinant is that age of the child. If the baby is of younger ages, the manageable, and as the age advances, the situations becomes bit tough. And the third point is the cooperation of the family members and the educational system or the environment where the child is exposed to. If the mama or both the parents are working and the child is home, no one to support him at home, or if his education system is not giving a proper support, if they are abusing him, they are not understanding his feelings, even if with our efforts, he won't be in a comfortable environment. So these three factors should be considered while deciding the prognosis of this, especially in a condition with ADHD. If it's a younger age, if the condition is less severe, and if the environment is very much supporting, you can manage it in a period of like 3 or 4 months. But if everything is ulta, you may need more time.
Right, ma'am. And what about Mayur Grit, ma'am?
Mayur Krita, I don't have any clinical experience regarding managing this condition with Mahamayur Krita, and it's not easily available in Kerala also. So I don't have any clinical experience. Sorry to say, ma'am.
But I think Panchagavya Grit did wonders.
Panchakarma, sure. Panchakarma can do wonders. And
Panchagavya Grit.
Panchagavya Krita is also very nice. Especially in the initial stage of like the Samapajan, Srodashodan and all, Panchagavya is very nice. But in the later stages, I go usually for Vata Pitta Shamana Kritas like Tiktaga. And if you have completed the Shodhana and all, Rasayana with Mahadiktaga is very wonderful. Even I use
so much.
Vairaskara Krita is also in that.
Thanks a lot, ma'am. Thanks a lot.
So it's really nice, ma'am. Just one last question that our another speaker, Dr. Dinesh sir, is with us. So welcome, Dr. Dinesh sir. So it's a really great pleasure to have you, sir, on this platform of Ayush Darpan. So I welcome you, sir. And the last question is, ma'am, give some tips for cerebral palsy. Dr. Leena is asking.
Though not included in the topic of child psychiatry, it's a common development disorder where Ayurveda has a promising hand to help the child. So we can manage it under the spectrum of Vata Vyadhi, especially the Pakshakata treatment line can be adopted very well. Be cautious of the associations like seizure and other complications in that. Otherwise, you can directly go towards the management protocol, usually narrated in the Pakshagada treatment line.
Yeah, definitely. It was really nice discussion. So I request Dr. Ketki to introduce our next speaker, Dr. Dinesh sir. Thank you very much, ma'am. It was really interesting, and I think we need some more sessions to discuss all the situations. Yeah.
Yes, ma'am. Ma'am, it was very nice session, ma'am. Now, moving ahead, let's welcome Dr. Dinesh KS sir. He is a professor and head of academic research, and he is also academician, researcher, practitioner, and public health specialist. Sir is having 17 years of teaching experience and 21 years of clinical experience. Sir is a PG in Ayurveda, MD Ayurveda, and pursuing PhD from Gujarat Ayurveda University. And he is gold medalist in Ayurveda Academy Excellence and award winner in different international paper presentations. Welcome, sir. Dinesh sir, hello.
Yes, sir. You can continue, sir.
Sir, you can unmute yourself, sir.
Now,
Yes, yes.
am I audible?
Yes.
Yes, sir, you're audible.
Okay. Respected Shilpa madam, previous speaker, Roshni madam, and everyone, very good afternoon. Today, topic is regarding certain Graha concepts. Probably maybe seeing my slides. All right?
Yeah. Yes, sir.
So how can we incorporate the concept of Graha in our day-to-day clinical practice? This is my topic. So the concept of Graha is different in my perspective. Actually, that is in the light of all the references. From Ashtanga Hridaya as well as from the Sushruta Samhita. What is the peculiarity of Graha? Is that is something many of the commentators are saying that it is beyond some human perspective. There are some evil spirits और भूत जैसा लगता है, जैसा कंसेप्ट जाता है. ग्रह के बारे में जब भी हम क्लास ले रहे तो सभी लोग थोड़ा क्यूरियोसिटी के अनुसार और उसके साथ अप्रोच करते हैं. मैडम ने मुझे हिंदी भी बोलने के लिए बताया है, इसलिए मैं बहुत मुश्किल से मैं हिंदी भी यूज कर रहा हूं. हिंदी बहुत it's not a good Hindi, so please forgive me. So in day-to-day common clinical practice, there are certain concepts of grahas are arising even while treating the COVID-19 cases or while treating any cases, there are some concepts of Graha. Before going into the details of Graha, why the Graha concept has originated, और उसी तरह हमारा जो लॉजिक है उसके ऊपर जो जितना कंसेप्ट हमारा शास्त्र में जब आ रहे हैं उस टाइप को, और उस जगह पे हम ग्रह बोलते हैं या बुध बोलता है.
Your voice is so just little low. Can you increase the volume just little?
Hello, hello, hello. How is it audible? Hello.
Yes, sir. Yes, yes.
Whenever we are getting an experience, चाहे वो बरसात है या नहीं है तो धूप है, whether it may be a thunder or it may be a disease, whenever we are getting human being, whenever he is getting an experience, he applies logic, no doubt. Everywhere he will apply logic. And if he is getting logical explanation, that will be converted to science. Otherwise, it will be converted to mythology or religion. Religion is the best answer for unanswered questions. The topic of Graha or Buddha Graha or any other areas like psychiatry or many other diseases today, many diseases like the question why. If you are asking the question why to any phenomena, you will not get answer. If you are asking two questions, what and how, you will get answer. That will be science. Similarly, many clinical conditions in Ayurveda, if you are asking the question why, you won't get answer. And if what and how, these questions are unanswered in any clinical condition, the answer will be Graha. Conditions are coming, and that part is otherwise known as Graha or Buddha. Buddha Graha is also mentioned. So, this is not only the peculiarity of Ayurveda, but even in science also is happening. This is a magazine. The magazine's name is Science. In 2005, their 125th anniversary was celebrated. 125th anniversary. In that series or that issue of that journal was 125 unsolved questions of the science. They have published 125 unsolved questions of the science. Hello.
Sir, hello, sir. Your voice is breaking, sir.
Audible?
Yeah. Now you're audible, sir.
Hello.
Yes. Now you're audible, sir.
Right now audible?
Sir, your voice is breaking.
Actually, right now I am Yeah, I am actually speaking from not from my usual.
Hello, sir.
Hello.
Sir. Now you are audible, sir.
Hello. Hello.
Hello, sir.
Yes, sir. Please continue. Continue, please.
Still it is breaking
Low and breaking, sir. Low and breaking.
because I am not doing from my usual site because it was an emergency condition and meeting. Hello.
Sir, you are audible now, sir. Please continue, sir.
1 minute.
Hello, sir. Please unmute yourself, sir. Sir, yes, now audible, sir. Please continue.
Yeah. Okay. My past slides, the take home message was something which is not going hand in hand with the normal logic, which are explained in clinical parlance as graha, which cannot be explained in terms of dosha, which cannot be explained in terms of dosha dhatu theory. It is the usual problem in graha rogas. The very same thing is happening in science. As I told you, 125 unanswered questions were published in Science magazine in 2005, which deals with a lot of questions which are unanswered by the science. Still, they are dealing with religious persons, not by the scientific people. For example, what is the universe made out of? This is an unanswered question. Similar is the condition with Graharoga. Many of them are unanswered with the normal Ayurveda logic and human being. The concept of Graha in Ayurveda is Graha one which grabs. Because if our logic is failing to explain something, even now also, if you are walking through a street, if something is or some sound is coming which is not familiar to you and which you never heard ever in your life, what will be your feeling commonly? क्या सोचेंगे? ये तो अभी तक सुना नहीं है इसी तरह साउंड. उस टाइम पे आप क्या सोचेंगे? ये है हमारा सवाल. उस टाइम पे हमारा thoughts ऐसे जाएंगे कि which is something which is not logical to your common experience, and you will think about some evil spirit. And similar is the condition in Graha Roga also. Graha one which grabs, they are picturizing the whole sambrati of certain diseases towards something, some evil spirits. It is not explained by the Tridosha theory or by any theories of Ayurveda. So, according to Dalhana commentary, everyone, not only the Dalhana, everyone explains Graha Roga in connection with all other clinical symptomatologies. Everybody is explaining maliciously and with some evil spirits, and which is not an explanation of Ayurveda logic. There are two types of Graha Rogas. Generally, in Ayurveda, there are several other sub-classifications, or other in regionally, in Kerala context, there are several other types of Graha Rogas are also dealt with. And if you are going to each and every state, there will be some cultural practices and mythological practices which are connected to these Graha Rogas. But in Ayurveda, there are two types of Graha Rogas are mentioned. Number one is are dealing with psychiatric diseases, because psychiatry is an area where human logic cannot reach beyond certain levels. So even now, so Bhuta Graha, and another is our common Balagrahas. What is happening in Balagraha, you know, till that moment, till the clinical manifestation occurs, there are several diseases, there are no diseases, and immediately there are acute fever, and there are severe cry, incessant cry of the child. So incessant cry preceded by the fever, and immediately a lot of clinical symptomatology either pertaining to respiratory system or GI system or the nervous system, which happens immediately. The duration and progress of the disease will happen, and immediately the child will die or turn to a handicap. This is the general symptomatology of Graha Roga in Kaumara Bhritiya. But what is happening in Bhuta Graha, you know very well. Sudden change in the Sila, Ajara, and Samsara, and in every aspect, the human behavior is sudden change is occurring in human behavior, and that is called as Bhuta Graha in psychiatry. So those who are totally unhygienic, they will be turned to totally hygienic one. So such a drastic 180-degree radical change in the human behavior is mentioned in Bhuta Graha, and a sudden onset of the clinical symptomatology, maximum in 3 systems are happening in Balagraha. This is the general trend of Graha. So in that, nowhere else Tridosha is coming. It means that Tridosh ki hisab se, या आम के हिसाब से, स्रोतस के हिसाब से, धातु के हिसाब से कोई एक्सप्लेनेशन हम नहीं दे पाएंगे उस टाइम पे, और एक्सप्लेनेशन करने का टाइम भी नहीं मिलेगा. मतलब तुरंत फीवर आते हैं और तुरंत रोते हैं, और immediately the child will turn to convulsive and finally the child will turn to either death or there will be permanent handicap. So there is no time to explain the Samrati event. Whether it may be Dwara, or it may be Rektapitta, or it may be Asa, Swasa, all those are chronic diseases mentioned in Ayurveda. Nowhere else acute diseases are mentioned. Even Mada Murchaya Sannyasa like conditions or Rektapitta like conditions are mentioned, acute and chronic in origin. There will be a chronic predisposing, Samrati will be there, and an acute manifestation will happen. This is the style of presentation of acute diseases in Ayurveda, but Graha Roga is not like that. These are acute manifestations. Immediately, the child will get an immediate dosha aggravation in Sannipadika level, and finally, the child will die or turn to handicap. This is the peculiarity. And in common diseases, you can see a lot of such unexplained outcome of the disease, either positive outcome or negative outcome. So if present scenario, we are not calling it as Graha. Why? Because the concept of Graha is not logical. But we are calling them or such outcome as unexplained or idiopathic. I will give you certain clinical examples where Tridosha Dushti is happening. At the same time, the Tridosha theory is unable to explain its outcome. I will say you one common example in allopathic practice, for example, if somebody is giving paracetamol for a fever case, usually the fever comes down. If any child or adult, if he is going to a liver failure, the usual dosage of paracetamol administration, what will be the explanation? Is there any explanation in modern science? In my knowledge, no. He is prone to develop damage by the paracetamol. That is the only explanation. Otherwise, all other explanations are idiopathic or unexplained. Many of such areas are there in which the clinical outcome is totally turning to a fatal side or totally turning to another positive side. Even if it is turning to positive side, we will call our God as a savior, or if it is on the negative side, we will call an evil spirit or booth bolte hai or unko evil spirit bolte. This is the right and left turn of unexplained clinical outcome of either your treatment or your clinical manifestations. Of course, there are some chronic conditions also in Graha Rogas like Shushka Revati or Mugamandadiga, but still chronic, even though it is chronic origin, duration and progress, majority of them are unknown. Also, you know, even though the Kumara Shosha is mentioned, Varigarbhiga is mentioned, and Vyadijafaka is mentioned, but all those are clearly mentioned. Samratis are there. If such Samratis are not there, still, if the child is having this sort of shosham or shushkam or mugamantadiga panipat asiramaniyata, in which in which there are constant fever, ascites, and the caput medusae, capillary enlargement. Everything is not explainable by our Trudosha or any Stanya Trudosha Meline, or another ways we can either we could say it is Shira Dushti or it could be Ahara Dushti, but nothing is explainable. Everything is perfect. But still, if the child is turning to a marasmic child, that will be the explanation. There, the Trudosha theory fails. And at that time, we are forced to explain it in terms of Graha Rogas. So, any condition with much rapid origin, duration, progression are able to explain in terms of our logical brain or otherwise our Tridosha Siddhanta, then we can call it as Graha Roga. And mostly these are connected to some myths. In Indian culture, they are connected to Indian mythology. In Greek, it is Greek mythology. You may be heard about Pandora's box. Pandora's box is usually called it as abdomen is called as Pandora's box. Or abdominal diseases are several times Pandora's. All these are Greek mythology. So in every culture, the unknown etiology or unexplainable manifestations of the disease are connected to their own cultural background and their mythology. And such mythology in Indian context, in Ayurveda, they are called it as Graha Rogas. All we know the general symptomatology. If Pradatam Rodanam Jara, incessant cry, Pradatam Rodanam Jara, if the Jara is happening and always with a lot of cry, incessant cry, previously, even now also, if both old age people practice even in the infantile colic, in infantile colic, all of you know that there will be 3 hours of duration for the cry. It will be in the 3rd week or 3rd month. It will be lasting for 3 weeks. But in that case, हमारे यहाँ जो elder people क्या करते हैं, आपको है वो मिर्च और हमारा सरसों ये सब वगैरह पूजा करके रसोई में डालते हैं. They are put into the kitchen in the fire, and whenever the fume comes, it will come down. Actually, what is happening, you know, all these are self-limiting diseases. But during that time, a time period of say it may be 1 hour or 3 hours, the child will be totally child will be in a crying mode, incessant cry will be there, and associated if the fever is also coming, the condition turns into non-limiting conditions. So here, the general symptomatology, the terminology Jwara give that it is not necessarily a self-limiting disease, but it may turn to some other fatal edge or a handicap edge. And you see, in almost all the symptomatology or general symptomatologies, CNS system is getting involved either primarily or secondarily. So most probably that will be a meningitic pathology or the central nervous system pathologies are getting suspected with the immediate origin, duration, and progress of the disease. So in my clinical practice, in every cases like this, probably it may be hand, foot, and mouth disease, just 1 day prior to the hand, foot, and mouth disease. Or it may be any varicella virus infection, or even the certain severe cases of German. 1 day prior to the episode of the fever, there will be a total incessant cry, and the child will come to us, and you can see, or even in our clinical symptomatology of our all graha rogas, acute in nature, you can see the first dosha which has to be manifested or which has to be managed is nothing but pitta dosha. Pitta dosha is the only dosha where high fatality outcome is coming in the human body, or immediate dhatu paga is occurring. Of course, the clinical symptomatology will be due to that dhatu paga, there will be vada vriddhi, rasar dhatu, and the clinical manifestation will be shown or rodanam, pujanam, this deenada, dainyam, and this severe fatigue, the child will be totally tired. All these are the symptomatology of pitta dosha, and all other symptoms are like convulsive disorders are happening as a result of vada dosha. Vada dosha is only secondary due to the dhatu paga, dhatu degeneration. So dhatu paga, which leads to dhatushaya, and finally there will be vada vishesha. This is the usual progression. Okay, so my humble request to you is that whenever you see a case of graha roga, whether it may be meningitis, or it may be a varicella, or it may be German measles, or it may be in village practice, before rushing into the hospital, if a case of meningitis comes, immediate dosha that has to be managed is pitta dosha, because that is mahagadam, like Rektabita, it is mahavegam, agnivatsikragani, and mahagadam. In case of all such graha rogas, there will be predisposing other murchaya and sannyasa that may set in later on. So all of a sudden, if you want to manage the child clinically, immediate rektamoksha on the Shankar region by Jalauga, or immediate pitta dosha shamanatvam has to be given. They are giving muhur administration of Guluchadi Kwadam, Suvarna Muktadi Gudika, Gopi Chandranadi Gudiga. These are the different drugs what we are using or trying to use in such conditions, because we hardly get such fatal cases as a part of the usual cases. Sometimes some episodes of certain children are showing some episodes of such casualties in our hospital. That is the only experience what we have regarding such outcomes, fatal outcomes in our clinical practice. All we know, most of the Graha rogas are some way or in other way, they are encephalopathy cases or the gastroenteritis leading to sodium electrolyte imbalance, which leads to CNS manifestation. That is either the diarrhea or the vomiting, which finally leads to sodium electrolyte imbalance. Or otherwise, in other cases, either the metabolic shock or the septicemia. These are the four major conditions which are coming under Graha rogas, like meningitis or encephalopathy, then GI tract acute gastroenteritis leading to this sodium electrolyte imbalance, then leads to CNS manifestation, then septicemia, then metabolic shock. These are different diagnoses coming under these Graha rogas. Infantile colic, rule of three, all of you know. Majority of the self-limiting and relieving type of diseases are psychophysical, like infantile colic. In infantile colic, our usual treatment is not the homa or prayaschitta or this belly, mangala, nothing like that. But we are taking the child with a motorbike, and according to the pace of the cry, we will accelerate the motorbike. Gradually, the child will show the improvement. And the similar way, we are giving Vadanilomana and Deepanapachana like Chandra Gudika, Rajanyati Churna, like medicines, what we are giving in clinical practice. This is the usual clinical presentation where Graha rogas are being suspected here in Kerala. Even today, Devabrasa are applied. And in case of degenerative diseases of the brain, like lipid storage diseases, like this, you can see a lot of children are showing unexplained nocturnal cry, which will be relieved by its own. There are several hypotheses which are mentioned, but still majority of them are unexplainable. And in all such cases, even in the hospital, we are forced to do Astabhyam, Grivayam, Murdhini, Visheshal, Satam, Vaja. The Vaja will be tied over the neck and on the hands and on the buttocks. And these are the usual procedure what we are doing, even though there is not much scientific explanation in modern perspective. But probably the self-limiting nature of the disease, or it may be due to something other than that. Any non-linear equation. Usually such cases are coming down very easily. And along with that, you should give all other medications like Vadanilomana, Deepanapachana, like nowadays, the Hemp Street, you know, the new company which has launched certain medicines by incorporating hemp, our Vijaya. And one such beautiful product is Trilokya Vijaya Vadi. Trilokya Vijaya Vadi. Medical marijuana is not being accepted in our country, but still this drug has got a license. And I am extensively using in pediatric practice also, even though I am using in acute and recurrent relapsing pancreatitis. I am using in such of infantile colic with a controlled dose. And I am using in several types of other unexplained cry. And if you are suspecting some underlying pain in the GI tract or in the reticuloendothelial system, I am using Trilokya Vijaya Vadi. Vijaya, the cannabis, which is having powerful action both psyche and soma, and which can be very well used in such cases. In autism disorders, there are certain actions can be seen, or we can see a lot of symptoms. It invites a lot of curiosity to us, to the total logical brain. Left side of the brain will be astonished by seeing several symptoms of Asperger syndrome, such as the child who is multiplying 5 digits numbers more than in the speed of a calculator. And I have several Asperger syndrome who are reading the mind of certain other people. If I am showing one number or one word to another person, that word will be reproduced by this child. पुराना जमाना में ग्रह बोलने के लिए दूसरा मौका नहीं है, इसी तरह मौका कहीं पे भी नहीं मिलेंगे भी. But here there is no patent. There's a lot of medical curiosity, savantism. We call it a savantism. And whether whether correction is needed in such cases is another question. Whether we are normal or they are normal is another question. But I'm telling, many people previously, before the invention of autism, Asperger syndrome, even now also in village area, many people are worshipping such children with puja and all other things. They are considered as grahas. Adradya management is needed, like behavior therapy, speech therapy, sensory integration therapy. Non-modifiable qualities are there in Savant syndrome even today, and which are not necessarily be managed. You know, if one child is having an evolving cerebral palsy, we are not sure that the child is having cerebral palsy. There is no scarf sign or anything like that. Child had the history of hypoxic ischemic encephalopathy or metabolic shock or metabolic encephalopathy. But for the 3 months, first for the 3 months, the child will be always crying on and off fever. There will be tityagishana. There will be constant neurological manifestations, but there will not be any, or we cannot say it is not spasticity, but spasticity cannot be differentiated in such children. Many people are leaving that cry with the but if we are managing it successfully by our CP management, even from that age, the history of hypoxic ischemia is there. We can manage it by our Dravya Chikitsa. But this is a particular condition where Graha Chikitsa invitation, what we are getting a lot. And in many cases of Abhasmara and Swasa, the concept of Graha creep in unexplained phenomena. That is, whether it is physiological or pathological, we can't explain even sometimes. Because the human body is such a collection of several possibilities. This is not told by me, but all the scientists are agreeing that human body is a collection of several possibilities. That is the reason why, because we are finding out statistically p-value. So there are several possibilities, out of which one possibility is Graha. And in medical science, they are called as CHAOS. Our heart is having chaos, our lungs are having chaos. And these chaos are creating a lot of medical wonders. Like the child is clinically died, and after 3 or 4 hours, the child will get up. Such things will happen. Even though hemoglobin is 3, human being is surviving with day-to-day activities. Yes, I have such patients. multiple myeloma cases. I am treating such multiple myeloma cases, even though the platelet is 25,000 and hemoglobin is 3, there is no purpura, and there are the patient is doing all day-to-day activities. How is it possible? Yes, all these are unexplained medical chaos, and these chaos are very well recognized even by the British Medical Journal. You can read this article if you want. If you want to know more about chaos, the predicting, the unpredictable. This is an article by W.J. Firth, which is published in British Medical Journal. You read this article, then you will come to know what is Graha more easily. And the very same linear questions are asked in Charagal Chariot in second chapter. Kasmat Prajam Sri, Pragatam Prasude, in Adigangi Vikalentiyamma. Very same 125 questions which are asked in Science Journal. These are the different areas where such medical areas are mentioned in our science. And in genetics, you know, even now also, I am totally astonished by seeing one of my patients who were diagnosed as spinal muscular atrophy type 2. Spinal muscular atrophy type 2. All we know, 18 crore drug is needed for that. More than 90% of SMA cases in my clinical places, in clinical experiences are passed away, especially the 1-2 types. And one of my SMA case is right now going to school, genetically diagnosed case, but later on, genetic specialists are saying that that may be due to the error in the genetic test. It may not be a case of SMA. That is the explanation from Bird Genome Laboratory. Or it may be some concept of epigenetic change that might have happened, but it is very, very less chance. Even with the preconception care, autosomal dominant condition like multiple neurofibroma, we can produce children who are not having multiple neurofibroma if you are doing proper preconception care, but it is not guaranteed because everything is chaos. How it is happening? There is no explanation in Mendelian inheritance. It is an autosomal dominant condition. Certainly, the child should produce neurofibroma. So, such cases or such experiences are there in every medical science, not only in Ayurveda. We are also having such wonders, and all those are the positive side of Graha explanation, not the negative side of explanation. In cases of certain skin diseases, unusual outcome, even though there is no scope of any sepsis, because the child has already cured almost all the areas of skin diseases. Maybe a staphylococcal infection, it is a Balavisarpa, but as the treatment continues, immediately septicemia set in the child dies. Within 1 day, there will be immediate rise of temperature and there will be death by showing all the symptoms of Skandagraha. So these are also happening. Seizures. There are certain seizures in which pitta in different sites can be seen. Seizures means, you may be knowing, apasmara and seizure is entirely different. Seizure does not necessarily need the smritya bhaya. That means the consciousness, the altered consciousness is not necessary in seizures, but in apasmara it is necessary. Smritya bhayam is necessary. So such seizures are also showing a lot of Graha afflictions in many clinical conditions. And this is my limited empirical observation regarding the Graha, that whenever the Pitta dosha is situated in Tuk, Vispoda and Masurika will be become Tujit. find it, such cases are showing many graha afflictions in are not addressing it properly. Rekta visarpam daha mamse mamspaka kodana. Visarpa and daha cases. That is pitta in rekta dhadu. That is the chance of graha roga. Pitta in majja. Majji haridra naganetra. All those are neoplastic disorders, not the common part. In all neoplasm, you can see the presence of graha rogas, which has to be managed. Of course, you can manage. I am not a person of this Daiva Basra Chikilsa because I don't know that. That is the reason why, because I am not doing Daiva Basra Chikilsa. But I do Pitta Shamana Chikilsa. I do Pitta Shamana Chikilsa in case of chronic myeloid leukemia, in case of multiple myeloma, and in many other pitta in majja cases. You can see a lot of graha afflictions and intractable jaundice cases. So Pradarupa Purusha, finally it will reach to Pradarupa Purusha, that is severe cases of Udaram will set in. At that time also, you can see a lot of hallucinations, a lot of graha rogas, and the kaga gandhitvam and everything you can see. So you treat the pitta dosha up to some extent, you can manage it. Adaujas, excess fatigue, severe fever, anosmia, and Vishalakshana. That is the COVID lakshana. If the COVID lakshanas are not taken care of pitta dosha, if you are treating it with Ushna Krishna, if that kapapaitika jwara is treated by Dashamula Kadupaya, Amurdotaran Kwada, Panchakwalan Kwada, Tribhuvanek Tiresa, all those are turning to severe pitta goba, they will run to ICU. Samsrishte kapapittabhyam pittamado vindaye. You should manage the pitta dosha first. If so, you can prevent the entry into ICU. In that case, this we have published one article right now in the present JAME pre-print version. You can see our article in that. So, kapha pitta chikilsa, especially the pitta chikilsa, has to be given so that hataujas, that is Sanyabadika jwaram, ojas will not be affected. Ojas is affected when we have Gurutam Stabdadankeshu, Lanir, Varnasya Bhedanam, Tandra Nidra, Vada Shobo, Belavyapati Lakshanam, severe fatigue and severe tiredness, and finally they will be devoid of ojas, they will be turned, get into ICU. Certain movement disorders and acute confusional stages like epilepsy, migraine. You know, in certain children, hypothyroidism and migraine show as acute confusional stage. Immediately the child immediately after waking up from the bed, instead of going for the brushing, they will go to some other places and they will take रसोई से किचन से चाकू वगैरह लेते हैं और बैग में डालते हैं, स्कूल में जाने के लिए तैयार करते हैं, even without taking bath or brushing. That is the acute confusional stage. In that differential diagnosis, there will be, that may be epilepsy, or it may be migraine, or it may be hypothyroidism. In all such cases, you may see the presence of graha roga. Do pitta shamana chikitsa in all such cases. These are the usual drugs, except Vacha. All of these are pitta shamana drugs. Vacha, even though it is not pitta shamana, but Vacha is having that sort of prabhava to cure such cases. Dhubanam, Vacha Hingu Vilangani Saindavan Gaja people. This is the yoga which I am usually using in such cases. Immediate pitta shamana drugs like Muhur Guduchaki Padam, Muhur Suvarna Muktadi tablets. Muhur Gopi Chandraji tablets. That is 1 hourly from 6 AM to 6 PM, 12 doses per day. These are the usual medicines which I am using. Shiroleba, Suvarna Prasham, Gorojanati Gudika, Manasamitram, which I am using. Let me wind up because I came for this seminar with an apology that an important meeting is going on right now. I took a half an hour leave from there and I have to go back to that meeting. and forgive me for a short time. If it's necessary, I will take all these details in a detailed, in a discussion manner in any of the upcoming events. And by this, I am winding up. Thank you very much. Deepa madam.
Yes, sir. Is it over? Okay.
Yes, sir.
Yeah.
Okay, sir. Thank you very much. It was really great. Very nice topic. Very nice presentation, sir. Thank you very much. Now I would like to call upon our guests for any question, doctors, please. Yes, please. Dr. Raju, sir.
Madam, if
Is there
any
any
questions are there, please forward me. I will answer it WhatsApp. That will be more.
Yeah, definitely, sir. Definitely, sir.
Sorry
Yeah.
to one of my meeting. Okay, thank you. Thank you very much.
Yeah. Yes, Dr. Raju, sir.
Thank
Dr. Vandana, ma'am. Is there any question? Ketki?
No, ma'am, no. Very well explained, ma'am, by sir.
Dr. Shruti?
यस मैम, थोड़ा सा था लेकिन अभी सर शायद लेट हो रहे हैं तो फिर
Yeah, definitely. Interesting.
बट बहुत अच्छे से सर ने बहुत ही अच्छे से मतलब छोटे छोटे से पॉइंट मतलब इतना वास्ट सोच सकते हैं हम ग्रह रोग को, ये बहुत अच्छे से वो किया। थोड़ा सा मेरा कुछ क्वेरी थी बस, लेकिन अभी सर लेट हैं तो फिर हम बाद में लेते हैं। जी सर, जी।
Yeah, definitely. So thank you very much all. I think sir left. He is having some busy schedule today, so maybe. So thank you very much all the speakers. Dr. Roshni ma'am, Dr. Dinesh sir, Dr. Raju sir. बताइए sir, Dr. Raju sir.
धन्यवाद आपका बहुत बहुत। मुझे आपने तो में ग्रह विज्ञान जो बच्चों का है बहुत वास्ट टॉपिक है। पहले कहा जाता था कि ग्रह बाधा है, तो जब भी कोई जैसे आजकल वायरस या बैक्टीरिया जो सूक्ष्म जीव होते हैं जो सामने दिखते नहीं हैं, जो अज्ञात हैं, उनको ट्रेडिशनली ग्रह नाम से जाना जाता था। तो आज भी देखेंगे कहा जाता है मेडिसिन की भाषा में कि 85% डिजीज आर वायरल डिजीज एंड वायरल डिजीज आर सेल्फ लिमिटिंग, माने उसको एक्सपोजर होना है, उसको मल्टीप्लिकेशन होना है, एक्सपोज होने के बाद अपने ऑप्टिमाइज लेवल के लक्षण दिखाने के बाद अपनी इम्यूनिटी के हिसाब से उसको सेटल हो जाना है। तो बस इसीलिए बहुत सारी चिकित्साएं पहले होती थी, जैसे दैव्यवाश्रय चिकित्सा कि कोई बलि दे दी, या कोई जिसको आजकल की भाषा में आम भाषा में कहते हैं नज़र उतारना। बच्चे को कभी कोई परेशानी होती तो घर में भी सबसे पहला कहा जाता है कि भाई बच्चे की नज़र निकाल दीजिए। तो नज़र निकालने के लिए कभी कोई अपने दाल रख दी या कोई चीनी रख दी या गुड़ रख दिया। अब ट्रेडिशनली हर घर में देखिए कुछ ना कुछ बच्चे जब बड़े होते हैं तो मुझे नहीं लगता कोई भी बच्चा ऐसा है जो बड़ा हुआ हो और उसकी नज़र ना निकाली गई हो। तो आज की डेट में ये बातें कई बार हमें प्रासंगिक नहीं लगती हैं, लेकिन कहीं ना कहीं आयुर्वेद में हर चीज़ का वर्णन बड़े डिटेल से करा गया है। और ग्रह बाधा एक अपने आप में पूरा एक चैप्टर है जिसमें डिफरेंट टाइप के डायरिया से लेके ब्रेन तक के सारे लक्षण मिलते हैं, स्किन डिजीज के हर तरह के लक्षण। तो डॉक्टर साहब ने बहुत ही अच्छे तरीके से इसको बताया और कहीं ना कहीं हमें जो है विज्ञान के साथ साथ प्राचीन जो महर्षियों के ऑब्जर्वेशन है, कहा गया है आप्तस्तु यथार्थ वक्ता आप्त वचनम आप्त श्रुति, जो हमारे मनीषियों ने पुराने समय में देखा और उनका एक जो है आयुर्वेद सम्मत जो सॉल्यूशन निकाला, उसको रिगार्ड करते हुए विज्ञान की कसौटी पे उनको परखते हुए हमें जो है क्षीर दधि न्याय विवेचन के अनुसार उनको आत्मसात करना चाहिए। और जो ग्रह बाधा के संबंध में जो जैसे कोविड भी एक बहुत बड़ी परेशानी के रूप में आ रहा है, वो भी अज्ञात है, लेकिन आजकल हमारे पास डिटर्मिनेशन के चीज़ें हैं तो उनको हम आइडेंटिफाई कर लेते हैं। तो इन सब में जितनी भी ग्रह बाधाएं हैं, कहीं ना कहीं बॉडी की इम्यूनिटी का बहुत अच्छा रोल है। तो बॉडी की इम्यूनिटी के लिए चाहे आपका स्वर्ण प्राशन संस्कार हो बच्चों में जिसको हम कर सकते हैं, या बच्चों में कई सारी स्वास्थ्यवर्धक रसायन औषधियाँ जैसे कि ब्राह्मी, अश्वगंधा, मुलेठी, ठीक है, इसी तरह बराही कंद, बिदारी कंद और भी जो हमारे यहाँ बताए गए हैं संशोधन। और विशेष करके जैसे अभी सेरिब्रल पैल्सी की बात चल रही थी, तो बहुत सारे बच्चे व्रंगण चिकित्सा और जो है उसमें षष्ठी, साली, पिंड स्वेद इत्यादि चीजों से सही होते हैं। तो कहीं ना कहीं मतलब कौमार व्रत तो पूरा गागर है, जिसे कहना चाहिए सागर है पूरा, तो इसमें गागर के रूप में कौमार व्रत लिख दिया, लेकिन आप डुबकी लगाएंगे तो आपको नए नए मोती निकलेंगे। तो शिल्पा जी का बहुत बहुत धन्यवाद कि आप जो है अच्छे अच्छे मनीषियों को जोड़ रहे हैं। और निश्चित रूप से ये समुद्र मंथन की तरह ये है प्रक्रिया कि जब भी हम मथते हैं तो कुछ ना कुछ मोती निकलते हैं और उन मोतियों से ही आगे जाके एक अचीवमेंट होता है। और चिकित्सक जो जानते हैं उनका एक नया नया व्यू आता है सामने, और जो बच्चे हैं उनके लिए एक डायरेक्शन मिलती है। तो अध्ययन, अध्यापन और संभाषा ये तीनों ही एक हमारे विद्या अर्जन और ज्ञान को बढ़ाने वाले हैं। तो आई लुक फॉरवर्ड फॉर गुड फॉर्च्यून फॉर ऑल ऑफ अस, स्पेशली ऑल ऑर्गेनाइजर, स्पेशली शिल्पा जी, डॉक्टर वंदना जी, डॉक्टर रोशनी जी, कीर्ति जी, डॉक्टर दीवान जी, सभी ने बहुत अच्छा बताया। बहुत अच्छा, आपको साधुवाद, धन्यवाद।
Yes, yes, yes. बहुत अच्छा पॉइंट आपने उठाया था सर. एक्चुअली सर वाज वेरी वेल नोन स्पीकर ऑन ग्रह रोगा, बट टुडे जस्ट ड्यू टू बिजी शेड्यूल ही लेफ्ट द मीटिंग अर्लियर. जो आपने नजर उतारने का बताया उसके ऊपर पूछना था मुझे, बट स्टिल डॉक्टर श्रुति, कैन यू थ्रो सम लाइट ऑन दिस थॉट? Is there any
मैम मुझे भी
I think it's like psychological कुछ ऐसे like हमारा सम्मोहन बोलेंगे या हमारा मेंटल सेटिस्फेक्शन, वो whatever.
राजीव सर ने बहुत ही अच्छा जो अभी एक चीज बोली, मुझे भी मैम यही बोलना था, जैसे कि ये जो हमारा ग्रह
बात तो आज भी चलती है और बहुत चलती है.
जो
जब कुछ नहीं बच पाता है तो हम लोग उसकी तरफ जाते ही है.
जी जी, ये जो बाल ग्रह है ना मैम,
हमारे पास कुछ नहीं होता है तो हम लोग जाते ही, मतलब
जी जी जी, ये जो मैम बाल ग्रह है ना, ये जनरली जितना भी यदि हम पूरे लक्षण कंपेयर करते हैं ना, तो ये क्योंकि ग्रह बोल दिया है तो हम सोचते हैं ये ग्रह मतलब थोड़ा सा ऐसा पुराना टाइप का है. नहीं, यदि एक एक लक्षण पढ़े तो जितने भी वायरल डिसीजेस हैं, क्योंकि आयुर्वेद में कहीं भी वायरल डिसीज का अलग से वर्णन नहीं है, ये इतना सडन, ये वैकल्यम मरणम कारतम कुछ ऐसा श्लोक है, तो मतलब इतना सडन इसमें डेथ होती है. जैसे अभी कोविड भी देखते हैं हम, इसमें एक भी डिसीज को कंपेयर कर लो तो जो भी वायरल इन्फेक्शन है वो इतना जल्दी बॉडी में आके एक्ट करते हैं कि जो डायरिया वगैरह हो रही है या जो भी चीजें जो इम्पैटिगो वगैरह या कुछ ऐसे केसेस हैं इसमें, एपिलेप्सी के भी हैं और हेमिप्लेजिया, हाइड्रोफोबिया, तो ये सारी चीजें कंपेयर कर सकते हैं. आज हम मॉडर्न की नाम देख लेते हैं तो हमको लगता है कि ये मॉडर्न के नाम है, लेकिन ये ग्रह पूरे के पूरे उससे कोरिलेट होते हैं और प्रॉपर समझ में आता है कि ये वायरल डिसीजेस है. अब यहाँ पे जो शामक चिकित्सा सर ने बहुत अच्छा बोला, पित्त शामक चिकित्सा, और जो आप ग्रहवाद ये नजर उतारना भी बोल रहे हैं मैम, इसमें हालांकि काश्यप में ये मिल नहीं रहा है. जितना भी ग्रह है ये हमने बागभट्ट से और सुश्रुत से कलेक्ट किया है, क्योंकि काश्यप खंडित है तो कहीं ना कहीं वो होगा, लेकिन फिर भी इतना अच्छा धूपन बोला है. तो जो धूपन के टाइप्स हैं जिसमें 40 प्रकार के धूप बोले हैं, तो हम भी आज मिर्ची से कहीं किसी चीजों से करके उसको जलाते हैं. और एक रक्षा कर्म आया है कि जब बच्चा पैदा हो रहा है वो सूतिका गार में, उसके बाद उसकी रक्षा कैसे करना है. तो हम आज सोचते हैं अरे ये तो पुराने जमाने की बातें हैं, लोग मानते नहीं हैं, लेकिन उसमें चीजों को लेके, कहीं सींग को लेके हाथ में बांधा है, सर पे बांधा है, पैर पे बांधा है, काले धागे में बांधने का क्या है, उसके बाहर गुग्गुल उग्गुल जलाने का क्या मतलब है, लोबान, राई, इन सब चीजों का इतना अच्छा वर्णन है. तो हमको अभी लगता है कि नहीं हम बहुत मॉडर्न कल्चर में आ गए, लेकिन ऐसा बिल्कुल नहीं है. धूपन कर्म एक चिकित्सा के रूप में बोला है. दैव पार्श्व चिकित्सा में बच्चों में धूपन कर्म करना या ये नजर उतारना, यहाँ तक कि बलि वगैरह देना भी, तो यही मुझे थोड़ा सा भी था कि ये बलि वगैरह क्या इतना करते हैं, लेकिन करना चाहिए। यदि इतना ज्यादा ग्रह बाधा है, हम लेके चलते, आज कोविड का टाइम है, तो यदि हम करें तो शायद हो सकता है उतना अच्छे से करें तो वो उससे भी उतना फर्क मिले। धूपन पे तो हम आ गए हैं, लेकिन अभी भी बहुत सारे पॉइंट ऐसे हैं जो हमने छोड़ दिए हैं। तो मैं खुद भी अपने बच्चे का, यदि कहीं से आता है और बहुत ज्यादा रो रहा है, इरिटेट हो रहा है, आप बच्चे की सच में पानी से भी नजर उतार के देखिए या जला दीजिए मिर्ची, तो इफेक्ट पड़ता है। इस चीज को हम अंधविश्वास बोल ही नहीं सकते, क्योंकि हम तो करते हैं और उसका इफेक्ट तो मिलता है हमको तो, और दिया भी है। बाल ग्रह में है, धूपन अध्याय में है, रक्षा कर्म में है, यहाँ सब जगह बोला है।
और मिर्ची का, नींबू का जो भी है आज भी चलता है। नया नया गाड़ी लिया, नया कुछ भी लिया तो हम लोग फिर आगे चलते ही
हाँ
नहीं।
बिल्कुल बिल्कुल।
वैसे भी हम ये करें, बट कितने भी हम लोग साइंटिफिक बने, कितने भी हमने
हाँ शिल्पा जी,
आसमान के तारों को छू लिया तो भी मुझे लगता है ये रहेगा। और
शिल्पा जी,
डेफिनेटली
on this. Open term और ये है तो I would like to say one line on this कि जो भी हमारी डिजीज लगती है, हमने बहुत सारी चीजें इम्यून सिस्टम को बूस्ट कर रहा है, ये जो भी कुछ है, बट देयर इज एन ऑरा अराउंड आवर बॉडी, देन देयर आर चक्रास विच जिनके बैलेंस से हम अपनी बॉडी को स्वस्थ रखते हैं। तो कहीं ना कहीं ये जितनी भी दैवपाश्रय चिकित्सा होती है या धूपन होता है या जो भी है, तो ये एक तो वो जो बैलेंसिंग ऑफ द चक्रास उसको अलाइनमेंट करने में हेल्प करता है। दूसरा जो भी ऑरा है उसको क्लीन करता है, क्योंकि अगर ऐसा नहीं होता तो अग्नि स्नान जिसको हम आग से चारों तरफ से बच्चे के चारों तरफ करते हैं, उसके तुरंत बाद बच्चा ठीक हो जाता है। तो ये जो अग्नि स्नान है, दैट इज क्लेंजिंग ऑफ द ऑरा अराउंड द चाइल्ड और दी कभी अडल्ट के ऊपर भी करते हैं। तो इट हैज गॉट अ सिग्निफिकेंट रोल व्हिच इज बीइंग प्रूव्ड नाउ व्हेन वी मेडिटेट अपॉन, और हम अपने चक्रों को बैलेंस करते हैं विद द मेडिटेशन, तो मेडिटेशन के पहले और मेडिटेशन के बाद की वैल्यूज में भी अंतर आता है। तो क्यों नहीं ये हमारी बॉडी में चिकित्सा के रूप में असर करता ही होगा। तो जो ग्रह की चिकित्सा है, जो चाहे दैवपाश्रय के रूप में होती है, मंत्र चिकित्सा के रूप में, या जो भी बांधते हैं या अग्नि स्नान कराते हैं या जल से पूरी ऑरा को क्लीन करते हैं, तो उसका बहुत सिग्निफिकेंट रोल है। और सारी प्रैक्टिसेस में हमने, श्रुति मैम ने, आपने या कुरीले सर ने, सबने जीवन में देखा ही है इसको, और इसका कहीं ना कहीं यही इसका आंसर है। जी मैम।
बिल्कुल
बताइए सर, राजू सर बताइए।
एक काश्यप में एक योग है महेश्वर धूप, महेश्वर धूपन, तो अपने आप में इतना परफेक्ट योग है ये। इसमें श्वेत सरसों और आपका जो गुलू हो गया, इसमें जो है सरल चीड़ इत्यादि सभी चीजों से 5-7 चीजों से डाल के बनाया गया। मैं आपको शेयर कर दूंगा ये योग। और अभी कोविड में मैंने इसका प्रयोग करवाया लोगों को और सभी को दिया घर में, उसके लिए धूपन के लिए। तो महेश्वर धूपन अपने आप में एक परफेक्ट योग है। इसके अलावा काश्यप में धूपन के लिए स्पेशल काफी सारी चीजें हैं, कभी हम लोगों ने ध्यान नहीं दिया। और वेदों में तो हर बीमारी के लिए सूक्त है। आप ऋग्वेद में पढ़ेंगे, अथर्ववेद तो अपना डायरेक्ट ही वेद है, लेकिन जो इससे पहले जो निगम शाखाएं रही हैं ज्ञान की, वेद जो है निगम उसमें माना जाता है। तो हर व्याधि के लिए सूक्त दिया है, ज्वर के लिए, राजक्षमा के लिए, आज जो है कितनी बड़ी बड़ी बीमारियों के लिए, हर चीज के लिए सूक्त माने मंत्र। तो मंत्रों से लोग चिकित्सा करते थे। तो हमारे यहाँ चरक से लेके सुश्रुत में भी बताया कि जैसे कैसे गर्भणी परिचर्या में कैसे डिलीवरी के समय क्या क्या मंत्र पढ़ने चाहिए, हे सुख के अब तुम प्रवाहन करो, और पूरे मंत्र पढ़े जाते थे। तो कहीं ना कहीं हम अपने ट्रेडिशन को, हमें ध्यान नहीं है, हम उसको समझ नहीं पा रहे हैं, या वर्तमान के हिसाब से हम थोड़े उपेक्षा कर रहे हैं। लेकिन अगर हम देखेंगे, जिन खोजा तिन पाइयां गहरे पानी पैठ, तो अंदर जब डुबकी लगाएंगे तो नए नए चीजें निकल के आएंगी। और हमने जो है यही हमारा उद्देश्य है। तो मुझे लगता है काफी हद तक हम सफल हुए और मंथन की प्रक्रिया जारी रहेगी। धन्यवाद आपको।
बिल्कुल बिल्कुल सर, बिल्कुल आपने सही बताया। बिल्कुल इसको हम लोग अनुभव करते हैं, कोरिलेट करते हैं और सभी सब कुछ मानते भी है। बहुत सारी बातें हैं। तो एक मुझे बहुत दिनों से ग्रह रोग के ऊपर बहुत क्यूरियोसिटी थी कि कैसे हम आज के परिप्रेक्ष्य में भी देखें, क्योंकि ये तो हटा नहीं है, ये आज भी है। ये सभी चीजें जो आपने बताया सब लोग हम करते ही है। तो और एक दिन हम लोग इसी सर को बुलाकर एक सत्र ऑर्गेनाइज करेंगे और डिस्कशन करेंगे। बहुत सारी बातें अभी भी कुछ अनहिडन है मुझे लगता है। और हम भी मतलब धूपन का प्रयोग काफी सारे अभी इस पेंडेमिक में जैसे आपने बताया तो हर अस्पताल में हमने सवेरे शाम धूपन करवाया है, हमारे आयुर्वेदिक अस्पताल में भी अभी भी चल रहा है, क्योंकि वो बताया ही है अच्छा, और सब कुछ जो भी सारे योग है उसको प्रयोग करके ही किया है हमने। तो बिल्कुल एक प्रसन्नता आती है, बिल्कुल इसका एक अलग इफेक्ट आता ही है। तो मुझे लगता है आज के लिए यहाँ पर हम लोग रुकेंगे फिर। तो बहुत बहुत आभार आप सभी का भी इस सत्र में जुड़ने के लिए।
थैंक यू,
बहुत अच्छा लगा सबके
थैंक यू
साथ,
सो मच।
डिस्कशन भी अच्छे से हुआ, रोशनी मैम के साथ भी अच्छे से हुआ बहुत ही। सो थैंक यू वेरी मच डॉक्टर राजू सर, डॉक्टर वंदना, डॉक्टर गौतम, डॉक्टर कृति, डॉक्टर प्रिया, डॉक्टर श्रुति, डॉक्टर अनिता जी, सभी जो भी स्पीकर्स थे सभी का मैं बहुत आभार व्यक्त करती हूँ। फिर आज के लिए हम लोग रुकते हैं। धन्यवाद सभी का, नमस्कार। नमस्कार।